and a badge. So thank you for this lifetime memory you have made and created for us. This will go into the AFG office. Thank you very much, and we would like to felicitate with the plaque and Pharma for today's one of the session being sponsored by Koe Pharma. Thank you from the bottom of the heart from taking this lead.
We'll now start with our scientific session for the morning. For our first session, I would like to welcome our chairpersons. Dr. Ujjwala Netam, Madam. Madam is our AFG's premises secretary. Welcome, Madam. And Dr. Vidya Bandukwala, our managing committee member. Welcome, Madam.
Yeah, now I welcome our president of AFG, Dr. Nitin Shah, who has done a wonderful job through the year and has really kept us on our toes. So welcome, Dr. Nitin Shah. He is the recipient of the Golden Hand Awards, the recipient of Wonder Foxian Award, and he has the world records holder for removing heaviest fibroid, largest para-ovarian cyst, and a hysterectomy in a male. Yeah. 15 years of experience, 25,000 laparoscopies, national and international publications, 10 cover pages of Jogi, trained many gynecologist, and has done a wonderful tenure for this year as the president of AFG. I truly welcome you today, sir.
Thank you very much for that kind introduction. Without team, nothing can happen. So all the credit goes to my team, all the AFGites, AFG members, committee members, past president, trustee for keeping faith in me throughout the year, and we had a blast this year. So thank you very much. To know more, attend afternoon session of AGM. So I decided what to speak. Let not speak on some academic, but let's speak something adventure, something which everybody would like to do as an hobby or something alternative from day-to-day routine. And what life is meant for the good friends and great adventure. So I decided to join the EBC, Everest Base Camp track, and that was nothing but an high altitude track, which I didn't realize when I enrolled for Everest Base Camp. So I started a little bit searching on internet, and what I found out about high altitude track is any track about 8,000 feet is considered as an high altitude track. Between 8,000 and 12,000 feet above sea level is an easy track, but anything more than 12,000 to 15,000, the moderate risk is involved. And above 15 to 18,000, it's a hard track. Above 18, they are called actual mountains. So what we climb is not a mountains. What are the challenges of the high altitude track? With increasing altitude, the atmospheric pressure falls and oxygen saturation of the blood falls down. Hypoxemia can lead to the hyperventilation. Altitude sickness, the dreaded complication of the high altitude track is acute mountain sickness, high altitude pulmonary edema, high altitude cerebral edema. Last two being the very dreadful and can cause life of a person. So this track was decided on 29th April till 11th May in 2023. Why EBC? It was a kickstart to our sedentary lifestyle to experience thrill and adventure that hardly 1 in a million of the world population dare to seek. Happiness comes when you take your first step towards your dream. But what when you discuss your dreams with others? This is the reaction you get. Pagal hai kya? You know, so when I went to my coach, runner, dream trainer, that I am going EBC, he told me, okay, next year, we have ample of time to prepare. I told, no, I am going after 4 months in the April, and they told, pagal hai kya? You know, you require a very tough preparation for Everest Base Camp. It is not going to be easy job. But believing in yourself is the first steps to the success. The challenges is extreme cold, mental and physical preparation, fear of hypoxia, that is acute mountain sickness, and high pulmonary edema and cerebral edema. Preparation, the physical challenge, getting your body ready for the EBC was one more challenge to prepare in less than 4 months. But I came across that quote that the more you sweat in peace, the less you bleed in war. And that what keeps me going. So these are the preparation actually started 4 months before going for the Everest Base Camp. So regular daily exercise given by the coach, yoga and pranayam, hill running, staircase climbing with weight on the back and the trekking. This all were the part of the routine activity for that 4 months. The preparation schedule was given to us, which we used to strictly follow daily. But as we doctor, we always suffer from what is called as a time poverty. How to manage practice, surgery, OPD, and then fitness. To overcome the time poverty, I converted all my family vacations and conferences into opportunity. Whenever we used to go out, daily 1 hour, 2 hours, I used to practice in gym. Early morning, get up at 5 o'clock, go to the Borivali National Park, have 10-kilometer walk, run. In our gym, we go to treadmill, and this is how we started. Then during family vacation, when we go out, morning 5 o'clock, with my wife, just a beach walk just to prepare at 5 o'clock. So every opportunity was converted into a fitness time and was getting prepared for the final track. So this was the first track preparation before going for the Everest Base Camp. This was K2S track, famously called as, it is Karjat to Sihagar track. We don't know, we just enrolled for that track because we want to go to EBC. But it was a surprise. It was an overnight track. We started from Mumbai at 6 p.m. after finishing OT and all. We went to Pune, and the track started at 10 p.m. We were not aware that we are supposed to climb 15 mountains, climb up and climb down. And it was a tough time. Whenever we used to ask, और कितना बाकी है? 3 हो गया, 3 और बाकी है. The guide used to tell. So it was a 15 mountain, and the track was 17.5 kilometers. It was really a tough time to finish this track, and this is the final video you can see in the morning.
15 hills and 17 kilometers.
15 hills up and down and 17 kilometers total walk, 8 hours.
This was again a Kalsubai track, which is called as an Mount Everest of Maharashtra. But believe me, it was quite easy compared to K2S track, because here we have to climb only one mountain, but that was a high altitude. Then I regularly started joining Borivali National Park runners group, which gave me a 5-kilometer target every alternate day. And then we started running, jogging, and the stretching exercise what they provide was a game changer. What I thought I have a pelvic prolapse intervertebral disc and having backache just went off in 3 months by stretching exercise. So what we live is a state of chronic fatigue, chronic spasm. And because of this stretching exercise, I could come off with my backache. So that was a real surprise to me how much we are ignoring our body, our pain. Then I started climbing my own building, which is 28th floor building. I stay on 20th floor. After OPD, I used to climb. 6th floor आते ही lift पकड़ के घर जाता था, and then after slowly I went up to 20th floor climbing every day, and on every third day we used to climb 60 floor, then 120 floor, and finally I climbed Burj Khalifa, that is 155 floor. That is going up 30 floor, coming down in lift, again climbing, again coming down, and you do 4 and 5 times, you climb more than 155 floors. So this is how we prepared ourselves for the Everest base camp. And I almost lost 7 kg weight in that 4 months, because they say to climb the mountain, your own body weight is your problem, so better to lose some weight. So this was our schedule, what given to us. Day 1 Kathmandu, day 2 Lukla to Phakding, day 3 Namche Bazaar with a rest day on the Namche Bazaar, day Boche, Ding Boche, rest day at Ding Boche, Lobuche, Gorakshep and Everest base camp. This was what we had in our itinerary, but God had some different plan for us. So day 1 we accumulated all at Mumbai airport to take a flight for the Kathmandu. Everyone was too much excited, lot of high energy. And actually we reached Kathmandu and the temperature was 16 degree. This was the Kathmandu airport. There was a warm welcome by the team. Then we visited Pashupashinath temple, took some blessings so that we could complete our trek. And day 1 in the night, we went to the Thamel market. Few of our group member wanted to have some shopping before starting the trek. So, and there was a rain that day in Nepal. So this is how we enjoyed in the Nepal. And then next day we were supposed to travel. Our flight from Kathmandu was shifted to Ramechhap. So we took a bus from Kathmandu to Ramechhap by road, which was 145 kilometers and 6-hour travel time. En route we enjoyed a lot of scenery, but at the end you can see
bus timer belt has broken, and see the situation.
So we didn't reach our destination and timer belt was broken. We have to wait for the another bus. So all games started from Ramechhap. Next day we woke up to take a flight from the Lukla airport. And this is what you say. You type in Google the world's scariest airport and you get this answer. The Tenzing Hillary Airport, Lukla, is the world's scariest airport because there is a just short steep runway which ends in 9,000, 2,000 off foot cliff. So this was the experience of our flight we took from the Ramechhap. It was an exciting journey of 18-seater small aircraft carrier. I was sitting next to the air hostess and she asked me, आप भी ऊंचाई देख के आ गए कि एवरेस्ट बेस कैंप करना है? It is not that easy. It is not a joke to do Everest base camp. So she was laughing and we told, नहीं थोड़ा तो preparation करके आए. Hope for the best that we could finish. So this is the shortest runway for the Lukla airport, you can see. But we landed here safely. But only half of our member could reach the Lukla because this was the only flight that took off on that day. And another half of the team, due to the bad weather, they cut off all the flights and half of the members stayed back in the Ramechhap and they could not join us. So what we were supposed to do on day 1, we took a rest. We didn't proceed to Phakding and we took rest the Lukla only and we waited for our other team member to join next day. So on day 3rd, we went from Lukla to Phakding, which is actually a descent. And after all the team members joined, we went from Lukla to Phakding, and this was the day 1 track we started walking down to Phakding.
Today we have started from Lukla to Phakding, and we may walk for.
So this is how our luggage used to carried by the duffel bag should be carried on the back of the yak. This was from Phakding to Namche Bazaar, day 2 of the track, where the ascent we gain. Every day we gain ascent of 500 to 800 meter above the sea level so that our body get acclimatized. But since we spent extra night at Lukla, our rest day on Namche Bazaar was cut off and we could got only 1 night stay at Namche Bazaar. And from there, immediately next day we went to further destination. So this was our routine day track schedule. We wake up at 5 a.m. early morning, yoga, warm up, get duffel bag, get water bottle ready, breakfast and start for walking till the lunch, have a lunch and again walk for another half a day and reach the destination before sunset. So daily morning yoga session, then this is the Sargam Matha National Park we reach. In between we had a beautiful views of the mountain, we used to enjoy everything. This was the double Hillary Duswell suspension bridge en route, which is quite iconic.
And you can see
En route to the Everest base camp. So this is while starting from Namche. So this is a top view from the Namche. We meet few people who have submitted Everest, and we had 7 kids with us ranging from 8 years to 14 years, and they were the inspiration for them to complete their Everest base camp track. From day 3 Namche Bajar we reached Deboche, and it was a fully rain that day. Our entire clothes got wet inside the duffel bag. It was a tough time because there was a severe cold. So this was the mountain with rhododendron flower we can see, and this was the beautiful scenery we get en route. This is the Tengboche monastery, and a beautiful sunset we could witness while reaching Tengboche. This is our porter team who used to carry our luggage so that we can walk freely. This is a night view. In the morning, we are surprised to see these 2 peaks, which is also called as the mother-daughter duo peak. It's also called as the Amadamlam. From then day 4, Dekboche, we reached to the Feriche, which is at the height of 4,480 meter. Distance was again 10 kilometers. Daily the track duration was 10 to 12 kilometers. And every day you used to get an ascent of 500 to 1,000 meter above sea levels. So en route, this was the first view of the Mount Everest, what we could see en route. This was a famous carrot cake what we used to have.
We are going to have. Happy birthday.
This is again walking on the bridge.
Here comes
A lot of suspension
first
bridge
suspension
comes
bridge of the
in
day.
way.
and by this time you are complete. Just have a look.
And see the weight the people, local people carry with their on the back. So water intake management is very, very important whenever you have a high altitude trek. There should be at least 4 liter of fluid per day, 200 ml of which is a plain water and 200 ml of should contain electrolyte replenish. Nutrition, energy gels, chicky, chocolate, dry fruit we used to carry on the route to hydrate and keep ourselves well energized. So as the plantation above 4,000 meter, you can see the change in the plantation. Above you can see a quite amount of greenery, trees, but as the height increases, it converted into short shrubs and there is hardly any plantation. So this is the area where the oxygenation levels start falling. The Feriche is a small village, about 4 to 5 tea houses, last big medical center. You know, there was a medical center which was, after this there is no medical help you will get for the Everest base camp. So everybody used to get their checkup here, and few of our members were rejected and they have to get back. Out of 33 members, 6 members could not complete because of the development of some signs and symptoms of acute mountain sickness. So this was a acclimatization at Feriche where we went up and come down to acclimatize ourselves. And this we had some fun. Fashion show, just enjoying a day, rest day. And this is a small attempt of running and getting acclimatized at the height of 4,000 meter above sea level. Actually, it was majburi at 4,000 feet above sea level. And this was SpO2 monitoring. Daily our SpO2 was taken. It started from 100% to 92, 89, 83 and 79. So this was our saturation level which we actually was living with. It was really scary. Anybody in Bombay would have put it on ventilator. So this was the from Feriche to Lobuche journey. And you can see there are hardly any plantations. So even walking a small distance would get us breathless. Completing a sentence was not that easy. You can see people are walking with very slow pace here. But still there was a lot of energy and enthusiasm in the group which kept us going. And in between we see a lot of this Thukla Pass, which is an Everest memorial. So we could see some Indian names also in the center. Anjali Kulkarni, I think doctor from Maharashtra. And this was the acute mountain sickness. We had a 14-year-old boy got collapse. We carried oxygen cylinder with us, so we could save him. We could just give him oxygen, and he was rescued in helicopter from Feriche. So Everest Base Camp is a luxurious track because you get all the facilities on the earth because a lot of foreigner tourists come here. So that is how it is developed. And that was the final day where from Lobuche we went to Gorakshep, Gorakshep to EBC and back to Gorakshep. This was the longest distance, almost 15 kilometer we have to complete in a day. So this was the team which was ready and we started our journey. And this is the final walk for the summit. So everybody was hoping that we could finish this summit because walking a small distance was also a very problematic. We started very early in the morning because we have to cover a very long distance of 15 kilometers. Because rescue beyond Gorakshep is not possible. If something happens, you have to come back to Gorakshep to take the helicopter. And this was the final walk. You can see people are taking the baby steps. And finally we could reach the Everest Base Camp. And to our luck, we got a snowfall over there. So out of 33 members, 26 members could complete the summit. So this was the sunset view. So it is not the mountain we conquer, but we conquer ourselves. We cannot lower the mountain, therefore we must elevate ourselves. The hardest mountain to climb is one within our mind. Every mountain top is within your reach if you keep climbing till you reach the top. When was the last time you did something for the first time? What matters how you see yourself. Many times life is like this picture. You have a resources, but you take the poor decision. Don't let the bad day make you think you have a bad life. The miracle is not that I submitted. The miracle is that I had a courage to take the first step. So thank you very much for your patience listening.
Thank you, Dr. Nitin. And thank you for running us through your adventurous trip to Everest and the motivation that you had. So I must thank you. It is your last lecture as the president of AFG. And I must say your vision, your dedication, your enthusiasm is very contagious. So the incoming president has to go with it.
I think
Thank
he will
you
do
so
better
much,
than me to
Dr.
take the
S.
AFG to a greater heights. This was celebration at home.
सर आपने तो एफजी को भी माउंटेन पे चढ़ा दिया.
Thank you, sir. My wife. Because after that we completed Gaumukh with my wife, then Annapurna base camp with my family.
उसने धक्का दिया था कि आप खुद चला के गए थे?
Starting में धक्का दिया था, sir. So thank you very much.
So I think Dr. Nitin is an all-rounder. Not only professionally he is excelled, but in his financial knowledge also, and now this adventurous trek. And I think that is why he has performed as a best president. He is given the maximum number of programs, maximum MMC points, and maximum joinees for AFG, I think 54. So kudos to Dr. Nitin Shah.
Thank you, Nitin sir. Thank you, chairpersons. I request our chairpersons to felicitate our speaker, our one and only, our president, Dr. Nitin Shah. I request our secretary, Dr. Bela Bhatt, madam, to please felicitate our chairpersons. Dr. S.N. Agarwal, sir. Dr. Vidya Bandukwala.
I request all company people to please occupy the front seat. And request all the female to leave 3 rows empty. We will have some now Pujya Swami addressing the gathering.
For our next session, I would like to invite our chairpersons, Dr. Rajkumar Shah, sir.
Yeah, I would request the chairperson for the next session, Dr. Rajendra Saraugi, sir, to please come on the stage.
Our next chairperson, Dr. S.R. Desai, sir, Senior Consultant Gynecologist at Bhinder. Welcome, sir. Dr. Rajkumar, sir, will be joining us shortly. Dr. Manohar Motwani, sir.
नितिन सर को पूछो पहले जाओ क्योंकि सर आगे हैं स्वामी किधर आए स्वामी किधर आए
किसका लेक्चर
अच्छा ये स्वामी सर के ही है ना हाँ तो बोलो
स्वामी का इंट्रोडक्शन वो लोग देने वाले, उनके ही लोग देने वाले.
हेलो सभी को जय स्वामीनारायण। आज हम हमारे जो चीफ गेस्ट है वंदनीय पूज्य प्रसन्न मुनि स्वामी जी, उनका एक छोटा सा परिचय जानेंगे। पूज्य प्रसन्न मुनि स्वामी जी ने वर्ष 2009 में विश्व वंदनीय संत परम पूज्य प्रमुख स्वामी महाराज के कर कमलों से संत दीक्षा ग्रहण की है। संन्यास के अत्यंत कठिन मार्ग पर अग्रसर होने से पूर्व उन्होंने गुजरात की प्रतिष्ठित LD इंजीनियरिंग कॉलेज से मैकेनिकल इंजीनियरिंग में BE की स्नातक उपाधि प्राप्त की है। इसके पश्चात उन्होंने भारत के बाहर स्थित सबसे बड़े हिंदू मंदिर और उसके रूप में जो विश्वविख्यात है वैसे और पुरस्कृत है वैसे BAPS स्वामीनारायण मंदिर लंदन में अपनी अमूल्य सेवाएं प्रदान की है। परम पूज्य प्रमुख स्वामी महाराज के दिव्य जीवन से प्रेरित होकर उन्होंने समाज और आध्यात्म की सेवा हेतु त्याग का मार्ग अपनाया है। उन्होंने गुजरात के सारंगपुर स्थित सबसे बड़े संत प्रशिक्षण केंद्र में साधु जीवन की प्रारंभिक शिक्षा प्राप्त की। इस दौरान उन्होंने संप्रदाय के शास्त्रों के साथ साथ रामायण, महाभारत, श्रीमद् भागवत एवं श्रीमद् भगवत गीता जैसे सनातन धर्म ग्रंथों का गहन अध्ययन किया है। इसके अतिरिक्त इन्होंने संस्कृत, हिंदी एवं अंग्रेजी जैसी राष्ट्रीय और अंतर्राष्ट्रीय भाषाओं, विश्व धर्मों तथा मैनेजमेंट का अध्ययन किया है। 8 वर्षों के प्रशिक्षण के उपरांत परम पूज्य प्रमुख स्वामी महाराज एवं परम पूज्य महंत स्वामी महाराज की आज्ञा से वे पिछले 11 वर्षों से मुंबई में स्थित गेस्ट रिलेशंस एवं सत्संग प्रवृत्ति के प्रमुख संत के रूप में सेवा दे रहे हैं। उन्होंने BAPS के अंतर्राष्ट्रीय महोत्सवों में जनसंपर्क यानी कि PR की विभाग में महत्वपूर्ण भूमिकाएं निभाई है। उन्होंने विश्व के अति बड़े राष्ट्रपति, प्रधानमंत्री, मुख्यमंत्रियों, राजनैतिक एवं सामाजिक पदाधिकारियों तथा विशिष्ट व्यक्तित्वों से भेंट कर BAPS की वैश्विक गतिविधियों का परिचय कराया है और कई IIT और IIM प्रतिष्ठित जो इंस्टीट्यूशंस है उनके छात्राओं को और डॉक्टर्स, इंजीनियर्स, चार्टर्ड अकाउंटेंट्स को अपने व्याख्यानों के माध्यम से लाभान्वित किया है और देश और विदेश के अनेक सफल युवा और अधिक सफलता प्राप्त करे उसके हेतु मार्गदर्शन प्राप्त किया है। ऐसी वैश्विक प्रतिभा के धनी पूज्य प्रसन्न मुनि स्वामी एक उत्कृष्ट वक्ता, प्रवक्ता, पाठक एवं विचारक है। अनेक शैक्षणिक एवं सामाजिक संस्थाओं ने उन्हें उनके प्रेरक प्रवचनों के लिए आमंत्रित किया है तथा विभिन्न रूपों में उनको सम्मानित किया है। आज जब वे हमारे बीच उपस्थित है तो हम विनम्रतापूर्वक पूज्य प्रसन्न मुनि स्वामी से अनुरोध करते हैं कि पहले हम एक छोटा सा वीडियो देखेंगे और उनके बाद उनके व्यक्तित्व का लाभ लेंगे। जय श्री स्वामीनारायण।
शरीर को केवल दवाओं से नहीं जोड़ते, बल्कि अपनी मौजूदगी, अपने धैर्य और अपनी कोमल देखभाल से टूटे दिलों की धड़कन फिर से संवारते हैं। वे उन ऑपरेशन थिएटर्स में प्रवेश करते हैं जहां भय गहराई तक जम चुका होता है और मृत्यु बेदर्द होकर मंडराती रहती है। लेकिन जब वे वहां से जाते हैं तो जीवन उजागर करने वाली एक ऐसी टिकाऊ रोशनी छोड़ जाते हैं जो समर्पण की एक अमर ज्वाला बन जाती है। जब पूरी दुनिया गहरी नींद में होती है तब भी वे जागते रहते हैं, जीवन की अंतिम चौकी पर, खून, सांस और जीवन के रखवाले बनकर, प्रहरी बनकर। लेकिन इस प्रचंड भाग दौड़ में खुद डॉक्टर ही भीतर से बार बार घायल होने लगता है। न किसी चीर फाड़ से बल्कि थकान, नैतिक चोट और संवेदना की भूख से, फटीग, मॉरल इंजरी और इमोशनल हंगर से। ये ऐसा घाव है जो चीखता नहीं बस भीतर ही भीतर खोखला कर देता है। A wound that doesn't scream but quietly consumes. The pressures of the system are crushing. लंबे घंटों तक का श्रम, लगातार लक्ष्य सिद्ध करने का प्रेशर और सीमित व्यवस्था का बोझ कभी कभी उन्हें उस मोड़ पर पहुंचा देता है जहां सिद्धांत डगमगाने लगते हैं। ऊपर से समाज और परिवार की अपेक्षाएं सांस लेने की जगह तक कम कर देती है। ये रसाकशी हीलर को खींचती नहीं, केवल उसे भीतर से तोड़ देती है। जो कभी एक एम्बिशन हुआ करता था, जुनून हुआ करता था, वो आज जिंदा रहने की महज होड़ बन चुका है। और इसी दौड़ में हीलर वाकई खुद का इलाज करना भूल जाता है। वो भूल जाता है कि इस सफ़ेद कोट के भीतर एक पिता भी है, एक माँ, एक बेटा, एक बेटी, एक जिम्मेदार नागरिक, एक आध्यात्मिक साधक भी है। और इस वजह से यही सफ़ेद कोट सेवा का प्रतीक कम, दर्द छुपाने की ढाल अधिक बन जाता है। जहां उदासी, डिप्रेशन कमजोरी समझा जाता है, वहां मौन सबसे गहरी बीमारी बन जाता है। और अकेलापन किसी सांझ की धुंध की तरह रगों में उतर जाता है। और एक समय ऐसा आता है जहां हमें थामने वाले को थामने वाला कोई नहीं रहता। और तब बीमारी शरीर में नहीं, आत्मा तक उतर जाती है। इसलिए आज हम यहां जुटे हैं डॉक्टरों के सम्मान के साथ साथ उनके दिलों को भी खुश और स्वस्थ बना सके। यही होगी BAPS द्वारा हीलर्स को हील करने की शुरुआत, हीलिंग द हीलर्स।
श्री स्वामीनारायण भगवान की जय, अक्षर पुरुषोत्तम महाराज की जय, राधा कृष्ण भगवान की जय, सियावर रामचंद्र भगवान की जय, प्रमुख स्वामी महाराज की जय, महंत स्वामी महाराज की जय। आज का विषय है हीलिंग द हीलर्स। डॉक्टर्स पृथ्वी पर के देवता है। मनुष्य का जन्म होता है, जन्म से लेकर मृत्यु तक हर एक पहलू में, हर एक प्रसंग में डॉक्टर की आवश्यकता अनिवार्य रहती है। डॉक्टर्स जो निस्वार्थ भाव से सबकी सेवा का एक प्रण लिया है, सेवा उनके DNA में होती है। जैसे हमने देखा कोरोना टाइम पर सब ने अपनी शेड्यूल, अपना स्वास्थ्य सब साइड में रखकर सेवा को ही प्रधान रखा। तो एक अच्छा कार्य, एक समाज का अविभाज्य अंग डॉक्टर है। लेकिन डॉक्टर एक डॉक्टर नहीं है। मैन इज ए सोशल एनिमल। एक पिता है, पुत्र है, पति है, पत्नी है, भाई है, बहन है। ये सब रोल डॉक्टर को बजाने होते हैं। न केवल एक हॉस्पिटल चलाना और न केवल एक क्लिनिक चलाना एज अ विजिटिंग फैकल्टी, लेकिन उनको घर भी चलाना है, सोसाइटी के रूल्स भी फॉलो करने हैं, समाज के रूल्स समाज में भी रहना है। तो इस सभी प्रकार के रोल एक डॉक्टर को परफॉर्म करने होते हैं। और उसके अंदर जब प्लस माइनस आता है, क्योंकि जीवन इज़ नॉट लाइक ए नेशनल एक्सप्रेस हाईवे, 100 स्पीड में आपकी गाड़ी चली ही जाएगी। जीवन इज़ लाइक ए सफारी ऑफ ओशन। जब ओशन में जाते हैं तो उसमें वेव्स प्लस एंड माइनस, अप एंड डाउन होते ही रहते हैं। उसी तरह जीवन भी एक इस प्रकार की सफ़र है जिसमें कोई सुख दुख, सफलता निष्फलता, मान अपमान सम्मान, यह सब पहलू आते ही रहते हैं। और उन सभी के अंदर हमें बैलेंस करना पड़ता है। प्रोफेशनल लाइफ देखें कि संबंधों की लाइफ देखें, उसके अंदर एक रूल, गोल्डन रूल है, 40 + 30 + 20 + 10। 40% रिलेशन, 40% बिजनेसेस ऐसे होते हैं हमारे जो विदाउट एनी एफर्ट अच्छी तरह से चलते हैं। आपको कुछ एक्स्ट्रा एफर्ट नहीं करना पड़ता है, वो अच्छी तरह से चलता ही है, संबंध हो या व्यवहार हो। 30% संबंध ऐसे होते हैं, व्यवहार ऐसा होता है जिसमें आपको कुछ एक्स्ट्रा एफर्ट करना पड़ता है। 20% ऐसे होते हैं बिजनेसेस और संबंध जो बिगड़ते हैं, और 10% संबंध ऐसे होते हैं जो हमें हावी नुकसान भी करके जाते हैं। ये जीवन की एक वास्तविकता है। बिकॉज भगवान के साथ हमने MOU नहीं किया कि एवरीथिंग विल बी गुडी गुडी, सब अच्छा ही होगा। तो 40% रिलेशन ऐसे जिसमें कोई एफर्ट नहीं, 30% उसमें कुछ एफर्ट है, 20% है उसमें जो बिगड़ते हैं, 10% रहते हैं ऐसे होते हैं जो पूरा नुकसान करके जाते हैं। तो जीवन की ये विशेषता है। तो पहला एक सिद्धांत आता है एक्सेप्टेंस एंड कमिटमेंट। ये स्वीकार करना पड़ता है कि भाई 10% रिलेशन ऐसे हो गई जो दुश्मनाहट में आएंगे, 20% ऐसे हो गई जो बिगड़ेगे ही। एक एक्सेप्टेंस आ जाए जीवन में तो जीवन के सफल और निष्फल दोनों परिप्रेक्ष्य के अंदर हमारे अंदर स्थिरता रहेगी। हार जीत, सफलता निष्फलता आती रहेगी। माइकल जॉर्डन, one of the best basketball player, but he said, I have missed more than 9,000 shots in my career. I have lost more than 300 games. 26 times I have been appointed to play a game-winning shot and I missed. I failed again and again and again, and that's why I succeed. When he was in the school, at that time he was rejected from his school team. So he respected the decision of coach का decision respect किया. He accepted his minority, उन्होंने जो अपनी क्षमता नहीं है वो भी स्वीकार किया, and then he worked very hard. So परिस्थिति को जब आप एक्सेप्ट करते हैं कि नहीं इस प्रकार की परिस्थितियां जीवन में आती रहेगी, रिजेक्शन भी आएगा, सफलता भी आएगी, निष्फलता भी आएगी, आप प्रेसिडेंट भी होगे, प्रेसिडेंट का टाइम पूरा भी होगा, नया प्रेसिडेंट आएगा, उनका भी टाइम होगा पूरा। ये तो जीवन की एक सफ़र है, और उस सफ़र के अंदर जब हम स्वीकार करना सीखते हैं तो हमारे अंतर शांति हो जाती है। एक्सेप्टेंस एंड कमिटमेंट, एक्सेप्ट करते हैं लेकिन कई बार हमारे कमिटमेंट जो दिया है उसके अंदर हम फिर लिथार्जिक हो जाते हैं। चलो उनको करना हो तो करो, एक्सेप्ट कर लेते, वो ऐसा ही है, हमें सहकार उनका नहीं मिलेगा, ये स्टाफ अच्छा नहीं है, उसका सहकार नहीं मिलेगा, चलो मुझे भी कुछ करना नहीं है। एंड देन वी मिस्ड आवर कमिटमेंट। हमने जो प्रतिज्ञा ली थी कि सेवा, समाज की सेवा, देश की सेवा, लोगों की सेवा, उसमें से जब हम चूक जाते हैं तो अब हम कमिटमेंट पर नहीं रहते। तो एक्सेप्टेंस एंड कमिटमेंट, वी आर फ्रॉम BAPS। प्रमुख स्वामी जी महाराज हमारे गुरु, उन्होंने हमें दीक्षा दी। प्रमुख स्वामी जी महाराज का कार्य देखिए, 1971 में वो प्रमुख हुए, 1971 से 2016 तक वो रहे। एट द एज ऑफ 96 ही पास्ट अवे। इन 45 ईयर्स प्रमुख स्वामी जी महाराज ने 1000 से भी ज़्यादा मंदिर बनाए, जिसमें दिल्ली अक्षरधाम, कई लोग आप गए होंगे दिल्ली अक्षरधाम, गुजरात में अक्षरधाम है, रॉबिन्सविल में अक्षरधाम हुआ। 1000 से भी ज़्यादा मंदिर प्रमुख स्वामी जी महाराज ने बनाए। आपको पता है कि एक प्रोजेक्ट करना कितना डिफ़िकल्ट होता है। 1000 मंदिर के लिए 1000 जगह लेनी पड़ती है। 1000 जगह ले तो उसका क्लियरेंस करना होता है, लीगली कितना पेपर होते हैं वो सब। एवरी आफ्टर 15 डेज प्रमुख स्वामी जी महाराज ने एक प्रोजेक्ट, एक संस्थान भेंट दी, या स्कूल हो, हॉस्पिटल्स हो, कॉलेजेस हो, मंदिर हो, संस्कार धाम हो। आप सोचिए कि एवरी आफ्टर 15 डेज एक संस्थान खड़ी करनी कितना डिफ़िकल्ट है। हमें एक क्लिनिक में से 2 क्लिनिक करने होते तो भी कितना डिफ़िकल्ट होता है। प्रमुख स्वामी जी महाराज ने 1000 से भी ज़्यादा मंदिर बनाए, 1000 से भी ज़्यादा पढ़े लिखे संतों को दीक्षा दी, इतने सब कार्य किए। लेकिन प्रमुख स्वामी जी महाराज का जन्मभूमि प्रवासी के हरकिशन मेहता, उन्होंने इंटरव्यू लिया और स्वामी जी को पूछा कि स्वामी जी आप इतना अच्छा कार्य कर रहे हैं, इवन दो समवन क्रिटिसाइज यू देन व्हाट विल बी योर रिएक्शन, कि जब कोई आपकी क्रिटिसाइज करता है तो आप क्या करते हैं। देन प्रमुख स्वामी महाराज गिव एक्सेलेंट आंसर। प्रमुख स्वामी महाराज से कि जब हमारी कोई क्रिटिसाइज करता है, कोई हमारी भूल दिखाता है, देन वी इंट्रोस्पेक्ट कि हमारी भूल है, यदि है तो उसे सुधार लेते हैं। इंस्टेंट हरकिशन जी ने पूछा कि और नहीं है तो प्रमुख स्वामी जी महाराज ने कहा कि नहीं है तो हम हमारा कार्य चालू रखते हैं, भगवान उसको भविष्य में सद्बुद्धि देंगे, लेकिन हम हमारे कार्य में से पीछे नहीं हटते। महान पुरुष कभी वो जवाब देने में टाइम नहीं बिगाड़ते, डिस्कस करने में, आर्ग्यूमेंट करने में टाइम नहीं बिगाड़ते, वो अपना कार्य चालू ही रखते हैं। एक्सेप्टेंस एंड कमिटमेंट। तो जीवन में हमें भी इस प्रकार से कई लोग आएंगे, कहेंगे, ब्लेम करेंगे, हमारी गलतियां बताएंगे, एट दैट टाइम वी शुड इंट्रोस्पेक्ट, हमारी भूल है तो सुधारेंगे, नहीं है तो वी कंटिन्यू टू आवर वर्क। एक्सेप्टेंस एंड कमिटमेंट। तो जीवन में एक अगर इम्पोर्टेंस ये है। द सेकंड थिंग आई वांट टू टेल यू इज बैलेंस ऑफ लाइफ रिसोर्सेस। बैलेंस ऑफ लाइफ रिसोर्सेस। जीवन में बैलेंस इज वेरी इंपॉर्टेंट। आप सभी डॉक्टर हैं। विकास किसको कहते हैं? यदि एक बच्चा का जन्म हुआ और उसका ग्रोथ हो रहा है, उसे विकास कहते हैं। लेकिन उसका राइट हैंड ही बढ़ता है, लेफ्ट हैंड स्थिर रहता है, बढ़ता नहीं, उसे क्या कहते हैं? विकृति कहते हैं। विकास, देयर इज ए डिफरेंस बिटवीन विकास एंड विकृति। ओवरऑल डेवलपमेंट उसे विकास कहते हैं। पर्टिकुलर वन पर्सन और वन पार्ट ऑफ द बॉडी इज ग्रोइंग एंड अदर पार्ट आर नॉट ग्रोइंग, दैट इज कॉल्ड विकृति। हमारे जीवन में भी इस प्रकार से कई बार ऐसा होता है। हमारे जीवन में एक ही है कि विकास विकास विकास, डेवलपमेंट डेवलपमेंट डेवलपमेंट। मेरा नेम, फेम एंड मनी तीनों होने चाहिए जीवन में। एंड वी पुट ऑल आवर एग्स इन वन बास्केट, दैट इज कॉल्ड आवर कैरियर। कि मैंने इतना हासिल किया, मैं ये बना, इसने इतने पैशन किए, ये किया, वो किया, इतना मैं पोस्ट बढ़ी, ये इसका सेक्रेटरी हुआ, इसका प्रेसिडेंट हुआ, ये काम मैंने किया, ये काम वो नहीं किया। We sometimes attached to the figures कि how many people, फिगर्स के ऊपर हम फोकस ज़्यादा करते हैं। और वो फिगर्स, नेम, फेम और मनी, उसके पीछे इतना हम पुरुषार्थ करते, इतनी हम मेहनत करते हैं कि हमारा विकास नहीं लेकिन विकृति हो जाती है। एक ही परिप्रेक्ष्य में हमारा डेवलपमेंट होता है। हम भूल जाते हैं कि हम डॉक्टर नहीं, हम किसी के पिता हैं, किसी के पुत्र हैं, किसी के माता, किसी के पिता, किसी के भाई, किसी की बहन। वो सब रोल भी हमें परफॉर्म करने होते हैं। समटाइम्स वी बिकम द बेस्ट डॉक्टर बट फेलियर फादर। जितना कंपेशन हमें दर्दियों के प्रति होता है, कई बार उतना कंपेशन हमें फैमिली मेंबर के प्रति नहीं होता। तो इस प्रकार से एक विकृति हमारे जीवन में कई बार आ जाती है, एक विकास की दौड़ के अंदर। देयर इज ए वन बुक, एक बुक है द टॉप 5 रिग्रेट्स ऑफ द डाइंग पीपल। द टॉप 5 रिग्रेट्स ऑफ द डाइंग। उसके लेखिका है ब्राउनी वेयर। शी वॉज इन ऑस्ट्रेलिया एंड शी वॉज वर्किंग एज ए पैलिएटिव केयर नर्स। पैलिएटिव केयर नर्स के अंदर आप सभी जानते हैं कि जो दर्दी की मृत्यु निश्चित है, वो हॉस्पिटल में ट्रीटमेंट ले रहे हैं। 15 दिन, 2 वीक, 3 वीक, 5 वीक, 10 वीक में उसकी मृत्यु निश्चित है। डॉक्टर्स नो एंड पेशेंट भी नो। सबको पता है उस प्रकार के जो दर्दी अच्छी फैमिली में से, उनकी सेवा में ये ब्राउनी वेयर थे। वो सभी के साथ बातचीत करते रहते थे। उनको एक रिसर्च का विचार आया कि सबको मैं मिलती हूँ, बातें करती हूँ, तो उस प्रकार से एक रिसर्च करते हैं, एक एनालिसिस करते हैं सबको, सब दर्दियों को उन्होंने 2 पेपर दिए। एक पेपर में लिखा कि अचीवमेंट्स ऑफ योर लाइफ आप लिखिए कि लिस्ट बनाइएगा, और दूसरे पेपर में रिग्रेट्स ऑफ द लाइफ उसका पेज लिस्ट बनाइएगा। आश्चर्य ये हुआ कि सक्सेस और अचीवमेंट से ज़्यादा सबने रिग्रेट्स का लिस्ट ज़्यादा बनाया, और उसमें से एक कंक्लूजन निकाला, द टॉप 5 रिग्रेट्स ऑफ द डाइंग पीपल। मरते हुए व्यक्तियों ने जीवन कैसे जीना चाहिए वो जिंदा व्यक्तियों को सिखाए इस बुक में से। द टॉप 5 रिग्रेट्स ऑफ द डाइंग, उसमें पहला रिग्रेट था, आई विश आई हैड लिव माई लाइफ ट्रू टू माई सेल्फ, नॉट वॉट अदर एक्सपेक्टेड। हमारे जीवन में ऐसा ही होता है, लोगों के ओपिनियनों के ऊपर हम हमारा जीवन, हमारी लाइफस्टाइल, हमारी कैरियर बनाने का प्रयत्न करते हैं। शांति से बैठे हो, अच्छी प्रैक्टिस कर रहे हो, कोई आकर बोले हो इतने साल से प्रैक्टिस कर रहे, मर्सिडीज गाड़ी नहीं लाई आपने, ये नहीं लिया, वो नहीं लिया, कपड़े पहन के कोई कम फंक्शन में जाते थे, बोले ये सूट अच्छा नहीं लगता, ये कपड़े अच्छे नहीं, तुरंत हम डिप्रेस हो जाते हैं, अपसेट हो जाते हैं, बिकॉज वी गेव अवर रिमोट कंट्रोल टू अदर्स पीपल, नॉट विथ अस। सबको दूसरे को दे दिया है कि मेरा जज आप ही करो, उसके अनुसार मैं मेरा जीवन बनाऊंगा, और लोग कहेंगे कि यू शुड एट दिस एज यू शुड अर्न दिस टाइप ऑफ मनी, यू शुड क्रेडिट दिस टाइप ऑफ नेम फेम एंड मनी, एंड वी रन बिहाइंड दैट। और उसके अंदर पीछे हम भूल जाते कि पीछे हमारी प्रगति के पीछे कौन कौन रहा है, उन सबको हम भूल जाते हैं। सो दैट वॉज द फर्स्ट रिग्रेट, आई विश आई हैड लिव माई लाइफ ट्रू टू माई सेल्फ, not what other expected. Second regret, why on this earth I worked so hard. इस पृथ्वी पर मैंने इतना क्यों परिश्रम किया, क्योंकि आज बैंक बैलेंस में करोड़ों रुपया है, लेकिन ले जाने के लिए मेरे पास कुछ नहीं है। कोई अमीर व्यक्ति, कोई सेलिब्रिटी एक रुपया भी लेकर गया नहीं है, एक जमीन का टुकड़ा भी लेकर गया नहीं, एक चमची भी लेकर गया नहीं कि भाई चलो ये चमची मेरी फेवरेट थी, ये तो लेकर जाओ, कुछ लेकर जाने वाला नहीं हूँ। सो वाई ऑन दिस अर्थ आई वर्क सो हार्ड। आपकी मृत्यु के बाद जितना बैंक बैलेंस है वो आपके एक्स्ट्रा मनी है, जरूरत उतनी नहीं थी। थर्ड रिग्रेट्स, आई विश आई हैड करेज टू एक्सप्रेस माई फीलिंग्स। कई बार ऐसा होता है कि हम हमारे जो विचार है वो भी व्यक्त नहीं करते। क्यों? कि लोग क्या सोचेंगे, यदि मैं सत्य बोलूँगा तो लोग क्या सोचेंगे, यदि मैं ये बोलूँगा तो लोग क्या सोचेंगे। तो इस प्रकार से हम हमारे फीलिंग्स भी व्यक्त नहीं कर सकते। द फोर्थ रिग्रेट वॉज, आई विश आई हैड स्पेंड सम टाइम, इनफ टाइम विथ माई फ्रेंड्स एंड फैमिली मेम्बर्स। कि मैंने मेरे मित्रों के साथ और फैमिली के साथ समय ज़्यादा व्यतीत किया होता तो अच्छा होता। एक हमने ड्रामा देखा था, उसके अंदर संडे था, उसके पिताजी ऑफिस जा रहे थे, बच्चे ने पूछा कि पिताजी आज तो संडे, आज कहाँ जा रहे? तो बेटे संडे के दिन जाऊँगा तो 5,000 रुपये एक्स्ट्रा मिलेंगे मुझे। तो बच्चा के पिताजी, कैन यू फील वेट फॉर मी कपल ऑफ मिनट्स? कहा। बच्चा अंदर रूम में गया, अपनी सेविंग के 5,000 रुपया लेकर आया और उसके पिताजी को दिया, पिताजी आज पूरा दिन आप मेरे साथ स्पेंड करिए, इसके लो 5,000 रुपये। सो नो वन रिमेंबर योर टारगेट्स, योर अचीवमेंट्स, बट एवरी वन रिमेंबर योर प्रेजेंस। आप उनके साथ कितना रहे, कितना समय आपने उनके साथ व्यतीत किया। जो परिवार, यदि परिवार में सुख नहीं होगा, फैमिली में सुख नहीं होगा, तो आपको दूसरी जगह भी सुख नहीं आएगा। अब्राहम लिंकन, ही वॉज द वन ऑफ द बेस्ट प्रेसिडेंट ऑफ यूएस। कितना पुरुषार्थ किया, 10 से ज़्यादा बार उनका इलेक्शन में हारे, लेकिन उन्होंने कभी हार मानी नहीं। लहरों से डरकर नौका पार नहीं होती, हिम्मत करने वालों की कभी हार नहीं होती, वो उनका सिद्धांत था। खूब पुरुषार्थ किया और वो प्रेसिडेंट बने। इतना पुरुषार्थ किया बाह्य लोगों के लिए, लेकिन परिवार के अंदर पत्नी के साथ अच्छे संबंध नहीं थे। उन्होंने लिखा कि कई बार मुझे सुसाइड करने का विचार आया, 2 बार तो मैंने प्रयत्न भी किए लेकिन उसमें सफल नहीं गया। तो अब्राहम लिंकन जैसे प्रेसिडेंट भी अपने परिवार में जो सुख नहीं है तो उनको भी सुसाइड करने का विचार आता है। तो हमें भी हमारे परिवार के प्रति समय निकालना चाहिए। परिवार के प्रति हमारे संबंध अच्छे होने चाहिए, पति पत्नी के संबंध, पिता और पुत्र के संबंध, इसके ऊपर भी हमें फोकस करना चाहिए। ये भी हमारी लाइफ है, ये भी हमारा कैरियर है, ये हमारा सर्वस्व है। यह जब हमारे मन में स्थिर होगा, फिक्स होगा, तो हम अच्छी तरह से परिवार के साथ बैठ सकेंगे। आज हम क्या करते थे, परिवार के लिए 15 घंटे स्पेंड करते हैं। वाई यू अर्निंग सो मच मनी फॉर माई वाइफ, फॉर माई फैमिली, फॉर माई सन्स एंड डॉटर। परिवार के लिए हम 15 घंटे स्पेंड करते हैं, पुरुषार्थ करते हैं, मेहनत करते हैं, लेकिन परिवार के लिए 15 मिनट नहीं निकाल सकते। दैट इज अवर ट्रेजेडी। 15 घंटे परिवार के लिए काम करेंगे लेकिन परिवार के साथ 15 मिनट बैठने का टाइम नहीं है। बिकॉज आई एम वेरी बिजी, विल शांति से बाद में बैठेंगे। तो हमारे पास 15 मिनट समय निकालने का नहीं है। तो परिवार के साथ प्रमुख स्वामी जी महाराज, उनका बहुत ही बड़ा एक्सपीरियंस। प्रमुख स्वामी जी महाराज एक बार मुंबई के अंदर थे और पत्र पढ़ रहे थे। तब किसी ने पूछा कि स्वामी जी ये पत्र क्यों आए, पत्र में क्या होता है? तब स्वामी जी ने कहा ये पत्र में परिवार के जो कोई प्रश्न होते हैं उसके निराकरण के लिए पत्र आते हैं। प्रमुख स्वामी जी महाराज ने 7 लाख से भी ज़्यादा पत्रों का जवाब दिया है। आप गिनती करेंगे तो भी थक जाएंगे 7 लाख बोलते बोलते। आप रोज़ के कितने ईमेल रिप्लाई करते हैं वो भी आप विचार करिए। प्रमुख स्वामी जी महाराज ने पूरी जीवन दरमियान 7 लाख से ज़्यादा पत्रों का उत्तर दिया। तब स्वामी जी को पूछा कि स्वामी जी आपके पास कोई एक सॉल्यूशन है जिससे परिवार के सभी प्रश्नों का समाधान आ जाए? तब प्रमुख स्वामी जी महाराज ने कहा कि सभी परिवार के सभ्य एक बार शाम को जब समय मिले सभी एक साथ बैठे, जो भगवान के अंदर मानते उसकी प्रार्थना करें, फिर एक दूसरे के साथ क्वालिटी टाइम स्पेंड करें, एक दूसरे के साथ बातचीत करें, तो कई प्रश्नों का समाधान वहाँ से आ जाता है। प्रमुख स्वामी जी महाराज के 1 वर्ड, घर सभा, कि यदि आप घर सभा करेंगे तो परिवार के सभी प्रश्नों का समाधान आएगा। तो परिवार के साथ बैठिए, उठिए, परिवार को समझिए, स्वभाव को समझिए, क्योंकि वी स्पेंड इनफ टाइम टू लर्न हाउ टू यूज AI इन आवर मेडिकल फील्ड। AI का कैसे उपयोग कर सकते हैं उसके लिए हम काफ़ी टाइम निकालते हैं, प्रैक्टिस करते हैं, क्लासेस करते हैं, सब करते हैं, इवन एट वेरी यंग ओल्ड एज और यंग एज और वेरी आफ्टर मैनी ईयर्स एक्सपीरियंस, क्योंकि हमें अपडेट रहना है। उसी तरह हमारे संबंधों में भी हमें अपडेट रहना पड़ता है। आप सोचिए कि जब आपकी शादी नहीं हुई थी उससे पहले आप और आपके पत्नी मिलते थे तो कितनी अच्छी तरह से बातचीत करते थे। आधा घंटा, पौना घंटा, 1-2 घंटे कई को तो निकल जाते थे। लेकिन आज आप जब फैमिली के अंदर 20-25 साल से बैठे हैं, आज सुबह से लेकर शाम तक आपके घर में किस प्रकार का वार्तालाप होता है? मैं इतने बजे जाऊंगा, ये फंक्शन है, इतने बजे आऊँगा, रसोई का तैयार रखना, ये करेंगे, वो करेंगे। जस्ट वी आर टॉकिंग इंस्ट्रक्टिव फॉर्मेट, एक दूसरे के साथ इंस्ट्रक्टिव फॉर्मेट। देयर इज नो लव, नो पीस एंड नो हार्मनी समटाइम्स। तो इस प्रकार से हमें परिवार में भी एक समय निकालना है, परिवार के सभ्यों को भी स्वीकारना है। कई बार हमें लगता है कि हमें तो अब स्वीकारना है, परिवार के साथ बैठना है, लेकिन जब शादी से पहले तो अच्छे स्वभाव थे, शादी के बाद खबर पता चला इनका स्वभाव कैसा है और उसकी वजह से हमें सेट नहीं होता है। लेकिन स्वभाव को स्वीकारना पड़ता है। प्रमुख स्वामी जी महाराज एक अद्भुत सिखाते थे। वंस प्रमुख स्वामी जी महाराज वॉज टेकिंग लंच, और जब स्वामी जी प्रमुख स्वामी जी महाराज लंच लेते होते तो कई बार कोई संतों, कोई कार्यकर कुछ रीडिंग करते होते। तो 95 का प्रसंग है कि उस वक्त स्वामी जी भोजन ले रहे थे, एक कार्यकर स्वामी के सामने बैठे थे, दूसरे कार्यकर थे, संतों थे, और वो कार्यकर एक हमारा मंथली मैगजीन आता है स्वामीनारायण प्रकाश, उसका पठन कर रहे थे। उसमें रिपोर्ट था, लंदन का मंदिर ओपनिंग हुआ, लंदन मंदिर, उसका एक रिपोर्ट आया था। उसमें सभी कार्यकर वॉलेंटियर्स किस प्रकार से सेवा में जुड़ते थे वो बात आती थी। और उसमें एक शब्द वारंवार आता था कि सभी कार्यकर, सभी वॉलेंटियर्स पत्थर की घिसाई के लिए जाते थे। तो पॉलिशिंग का शब्द वारंवार आता था, पॉलिशिंग। तो वो जो कार्यकर पढ़ते थे वो पॉलिश के बदले पोलिस पढ़ते थे, प्रोनाउंसिएशन उनका पॉलिश के बदले पोलिस था। तो 2-3 बार किसी ने टोका कि भी पोलिस नहीं पॉलिश बोलो, फिर भी ही मिस्टेक अगेन एंड अगेन। उस वक्त सभी थोड़े डिस्टर्ब हो गए। तो प्रमुख स्वामी जी महाराज ने उस वक्त एक अद्भुत बात की कि स्वामी जी ने कहा कि वंस एक बार उनकी लिमिटेशन हमें पता चल जाए, देन वी स्टार्ट टू एडजस्ट आवर सेल्फ, नॉट टू एडजस्ट हिम, कि हम ही सेट होना चाहिए। उनको एडजस्ट करने के लिए प्रयत्न मत करिए, आप एडजस्ट हो जाइए तो इस परिवार में अच्छा रहेगा। जिमी कार्टर और उनके वाइफ के बीच में काफ़ी समय से प्रश्न रहते थे। एक प्रश्न एक होता था कि जिमी कार्टर ही, उन्होंने आर्मी में ट्रेनिंग ली थी, तो ही वॉज वेरी पर्टिकुलर इन टाइम। और उनके पत्नी थी, वो हमेशा लेट ही आते थे। जब कोई फंक्शन में जाना हो, टाइम दिया हो, तो उनकी पत्नी 5 मिनट 10 मिनट लेट ही आती थी। तो ऐसा वारंवार होता, और जब ऐसा होता तो उनके दोनों के बीच में एक प्रश्न होता, झगड़ा हो जाता। कई सालों से ये चलता था। एक बार जिमी कार्टर को लेक्चर के लिए बाहर जाना था, वो जल्दी उठ गए, उनको तैयार हुए। उस वक्त पता चला कि आज उनकी वाइफ का बर्थडे था। उन्होंने सोचा कि आज व्हाट शुड आई गिव हर एज ए गिफ्ट, गिफ्ट में क्या देना चाहिए। उस वक्त उन्होंने सोचा कि हमारे बीच में झगड़े क्यों होते हैं, कि टाइम के वजह से। उन्होंने एक चिट्ठी लिखी। वो चिट्ठी में लिखा कि आज के बाद कभी मैं आपको समय के बारे में टोकूंगा नहीं। ये चिट्ठी लिखकर वो निकल गए। उसके बाद कभी भी उनके बीच में झगड़ा नहीं हुआ, बिकॉज ही एडजस्ट हिमसेल्फ। उन्होंने अपने आप को बदल दिया तो सब बदल गया। तो उसी तरह जीवन के अंदर हमें अपने परिवार के साथ, अपने मित्रों के साथ समय निकालना पड़ता है। वो नहीं निकालेंगे तो उसका भी हमें पछतावा होगा। तो इस प्रकार से द टॉप 5 रिग्रेट्स ऑफ द डाइंग, मरते हुए व्यक्तियों ने जीवन कैसे जीना चाहिए वो हमें सिखाया। सो द बैलेंस ऑफ लाइफ रिसोर्सेस, कि हमें हमारा कार्य भी करना है, 8 + 8 + 8, 8 घंटे हमें कार्य करना है, 8 घंटे स्लीप लेना है, और 8 घंटे के अंदर हमें सब ये सोशल, फैमिली, प्रेयर्स और सब करना है। एंड थर्ड थिंग्स आई वांट टू टेल यू, फेथ इन गॉड एंड गुरु, भगवान में श्रद्धा। यूनिवर्सिटी ऑफ मिसौरी ने 50,000 से भी ज़्यादा रिसर्च पेपर पब्लिश किए कि रिलीजियन एंड स्पिरिचुअलिटी की व्यक्ति के जीवन पर कैसी असर होती है। उसमें से एक उन्होंने कहा कि रिलीजियंस एंड स्पिरिचुअलिटी हेल्प्स इन अनरिजॉल्व्ड इश्यूज ऑफ लाइफ। जीवन के कुछ ऐसे प्रश्न आते हैं जो हमारे पास उसका कोई कारण नहीं होता, कि उसका कोई उपाय भी नहीं होता। तो उस वक्त हमें रिलीजियंस एंड स्पिरिचुअलिटी के अंदर मानते होगे तो उसका सॉल्यूशन मिलेगा। उसका एक दृष्टांत है आर्थर एश। ही वॉज ए टेनिस चैंपियन इन 1973। he won the Wimbledon champion. He became the Wimbledon champion. 1973 में उन्होंने ट्रॉफी जीती। उसके बाद 1983 में उनको एक बड़ा एक्सीडेंट हुआ, गंभीर अकस्मात था, ब्लड ट्रांसफ्यूजन की ज़रूरत पड़ी, और उस वक्त ब्लड कोई HIV पॉजिटिव वाला ब्लड आ गया। धीरे धीरे उनको लक्षण दिखने लगे। 1993 के आसपास उनको पता चला कि उनको HIV पॉजिटिव है। लोगों को भी पता चला। एक इंटरव्यूअर उनके पास गया और उनको पूछा कि आपको ये रोग लागू पड़ा HIV पॉजिटिव, तो आपको ऐसा नहीं होता कि वाई मी, वाई गॉड हैड सिलेक्टेड मी, मुझे ही क्यों भगवान ने सिलेक्ट किया, इतनी बड़ी दुनिया है और उसमें से वाई मी, आपको ऐसा प्रश्न नहीं हुआ? तब आर्थर एश ने बहुत ही अच्छा उत्तर दिया। उन्होंने कहा कि विश्व के अंदर 5 करोड़ से भी ज़्यादा बच्चे टेनिस सीखने की शुरुआत करते हैं। उसमें से 50 लाख थोड़ा सीखते हैं, उसमें से 5 लाख थोड़े प्रोफेशनल सीखते हैं, उसमें से 5,000 ग्रैंड स्लैम के लिए जाते हैं, उसमें से 50 विंबलडन के लिए जाते हैं, उसमें से 4 सेमीफाइनल में जाते हैं, उसमें से 2 फाइनल में जाते हैं। और जब in 1973 when I won Wimbledon trophy, at that time I did not ask God why me. 5 करोड़ थे, why me? So why should I ask now why me? So religion and spirituality helps in unresolved issues of life. कि कई बात ऐसी होती है जो हमें भगवान के ऊपर छोड़नी ही पड़ती है कि भगवान की इच्छा से होता है। द सेकंड थिंग इज, भगवान में जब हम मानते हैं तो इम्पोर्टेंस ऑफ चैंटिंग, भगवान की नाम रटन की भी महिमा, उसका भी एक मेंटली और फिजिकली उसका असर होता है। यूनिवर्सिटी ऑफ पेंसिल्वेनिया और यूनिवर्सिटी फिलाडेल्फिया के 2 रिसर्च डॉक्टर, उन्होंने एक सॉफ्टवेयर बनाया साइको न्यूरो सॉफ्टवेयर, और उसके अंदर उन्होंने 4000 लोगों का एनालिसिस किया, एज वाइज उनको ग्रुप में डिवाइड किया। एक एज बनाया 1000 व्यक्ति को, 4 to 12 ईयर्स एज ग्रुप, सेकंड एज ग्रुप 12 to 22, थर्ड एज ग्रुप 22 to 60 और फोर्थ 60 to 80। ये सभी ग्रुपों को उन्होंने बताया कि आप 12 वीक्स तक एवरी डे 12 मिनट्स जो भगवान के अंदर आप मानते हैं उसका चैंटिंग करिए, और आफ्टर 12 वीक वी विल रिसर्च थ्रू साइको न्यूरो सॉफ्टवेयर के द्वारा आपके शरीर पर, मन के ऊपर उसकी क्या असर हुई वो हम चेक करेंगे। आफ्टर 12 वीक्स उन्होंने जो किया चेकअप, उसके बाद जो फिगर्स मिले दैट वाज पावरफुल। 4 to 12 ईयर्स का जो एज ग्रुप था उसके अंदर उनको 20 to 25% उनकी मेमोरी पावर बढ़ी। 12 to 22 का एज था, उसके अंदर उन्होंने देखा कि उनका कॉन्फिडेंस 15 to 25% इंक्रीज हुआ। 22 to 60 वो एज ग्रुप था, उसके अंदर उन्होंने देखा कि 20 to 35% शॉक एब्जॉर्बिंग पावर उनका इंक्रीज हुआ। जीवन के अंदर जो प्रश्न आते उसके अंदर कैसे हमें स्थिर रहना वो उसके अंदर इम्प्रूव हुआ। और 60 to 80 ईयर्स के जो एज ग्रुप था उसके लिए सबसे बड़ा तो हेल्थ मिलियनर होते हैं, तो उनके अंदर 20 to 25% हेल्थ इम्यूनिटी सिस्टम इम्प्रूव हुई। तो इस प्रकार से एज ए मेडिकल रिसर्च के उपयोग से भी देखे कि इस प्रकार से जो भगवान में श्रद्धा रखते हैं तो इनके सभी प्रकार के फायदे होते हैं। तो आज हमने देखा कि हीलिंग द हीलर्स, आप तो खूब सेवाएं करते हैं, समाज की खूब सेवा भक्ति निस्वार्थ भाव से सेवा की भावना से आप करते ही रहते हैं, रात दिन देखे बिना करते हैं। कई बार लोग आपको क्रिटिसाइज करते हैं, कई बार लोग ट्रीटमेंट के लिए आते हैं लेकिन आपको सजेशन देते हैं बिकॉज AI और चैट GPT में से पढ़कर आते हैं। तो इवन दो यू एक्सेप्ट देम, इवन दो यू ट्रीट देम, तो इस प्रकार से आपका भोग और समर्पण खूब है। तो हीलिंग द हीलर्स, लेकिन एक परिवार का जो सेक्शन है उसके अंदर भी कुछ रह ना जाए, इसके लिए BAPS संस्था खूब प्रयत्न करती है। प्रमुख स्वामी जी महाराज, वर्तमान गुरु हमारे महंत स्वामी जी महाराज, वो भी पारिवारिक एकता के लिए, परिवार में सुमेल रहे, परिवार के सदस्य एक दूसरे के साथ मिलजुल कर रहे। प्रमुख महंत स्वामी जी महाराज कहते हैं कि सबसे पहली प्रायोरिटी हमारे परिवार और परिवार के सभ्यों को दीजिए, उसके बाद परिवार में भी संप होना चाहिए। मोहन स्वामी जी महाराज तो संप की डेफिनेशन कहते कि हमारे परिवार में कैसी यूनिटी परिवार में होनी चाहिए। स्वामी जी को पूछा कि स्वामी जी संप का डेफिनेशन हमने जैसा सुना है उस प्रकार से आपको एग्जाम्पल देते, आप क्लैरिफाई करिए। कि स्वामी जी 10 व्यक्ति बैठे हैं परिवार के और एक जूस का ग्लास है, ऑरेंज जूस का ग्लास। तो हमारी डेफिनेशन एक संप मतलब 10 को एक सरखा इक्वल पार्ट में जूस मिलना चाहिए। सो दैट इज द डेफिनेशन ऑफ संप यूनिटी। कि सबको समान मिलना चाहिए, तब महंत स्वामी जी महाराज ने कहा कि नहीं, 10 में से एक व्यक्ति आगे आए, वो पूरा जूस का ग्लास पी जाए और 9 व्यक्ति राजी हो जाए, वाह वेरी गुड, यू डिड एक्सेलेंट वर्क, दैट इज कॉल्ड यूनिटी। सो इस प्रकार की यूनिटी भी हमारे परिवार में आए, उस प्रकार से BAPS संस्था प्रयत्न करती है। तो आज हीलिंग द हीलर्स के अंदर हमने पहला देखा कि एक्सेप्टेंस एंड कमिटमेंट, द सेकंड थिंग बैलेंस ऑफ लाइफ रिसोर्सेज, एंड थर्ड वन इज फेथ इन गॉड एंड गुरु। तो बस भगवान से प्रार्थना करते हैं आप सबका स्वास्थ्य अच्छा रहे, आपके द्वारा खूब सेवाएं हो, खूब यश और कीर्ति मिले और परिवार में भी खूब सुख शांति रहे। वैसे भगवान स्वामीनारायण और गुरु महंत स्वामी जी महाराज के चरणों में प्रार्थना करते हैं। जय स्वामीनारायण। थैंक यू वेरी मच।
प्रणाम स्वामी जी, आपने बहुत सुंदर तरीके से डॉक्टर का जो लाइफस्टाइल है रोज का, हम लोग सब भूल जाते हैं कि हमें क्या क्या करना है, क्या क्या नहीं करना है व्यस्त जीवन में, लेकिन आपने इतना सिंपल तरीके से सब समझा है, आप सबकी आंखें खोल दी। थैंक यू वेरी मच।
Request our chairpersons to felicitate our speaker. I request Dr. Anurag Bhate sir to felicitate our chairpersons for this session, sir. We'll now carry on with our scientific session. For our next session, I would like to welcome our chairpersons, Dr. Mukesh Gupta sir, past president AFG, past president AMC. Welcome sir. Dr. Rajkumar Shah sir, past president AFG and senior consultant. Dr. Seema Gadiwan madam, past president AFG.
Good morning, everybody. I think after this rejuvenating morning session, I just want to say one thought which was coming when I was hearing to Swamiji. In our Bhagavad Gita, it's written, Yam hi na vyachante te purusham purusham shaba. Sam dukkham sukham dhiram to mritutva kalpate. Meaning, even in the extremes of happiness or sorrow, we are able to maintain our mental balance. only then we are capable of liberation. And I think all of us go through these ups and downs and practices. And if we are able to maintain our mental health and emotional well-being, I think we've done our job. Thank you very much for being here in the morning. And let me invite the next amazing speaker. And all of us know the caliber with which he not only works, but also the kind of academic intelligence he carries. Dr. S. Krishnakumar, sir. Can we welcome him on the dais, please? With a huge round of applause. He's the Chief Consultant, JK Women Hospital, Fortis, past President of IIG. He has been in charge of training people at various different platforms, even to the extent of cadaver courses. He's course director of laparoscopic gynecology for IRCAD India. He has special interest in adolescent and geriatric hysteroscopy. Over to you, sir.
Thank you, Chairperson. And it's, of course, a great honor for me to be here. It's on, karo? It's on. It's definitely a great honor for me to be here, but I really feel blessed to have been here from the morning. The AFG president took me to the Mount Everest, but Prasanna Muni Swami took us beyond the Mount Everest. So it was really an eye-opening talk for us, and of course at the end of my talk, I hope, change nahi hota hai? Change nahi ho raha. Of course I must congratulate the AFG president, who should have been an influencer rather than a gynecologist, but he still influences all of us, whether be it gynec, money, everything is an influencer, and I'm sure you will agree with me for having some wonderful events for you all here. And it's been really wonderful for me to also, I think this is the second or third event I am here, and I'm going to be talking on adding golden touch to our hysteroscopy beyond the mundane. And I hope at the end of my talk, I can influence you all how to carry out intrauterine surgeries. That's my motto, my desire. Well, we all have come a long way from the blind intrauterine surgery which we were doing, and we are all blessed that we had hysteroscopy in our midst now. But today, we all do hysteroscopy, we all mastered the routine hysteroscopic procedure between the reproductive age group, be it a septum, polyp, adhesion, myoma, everything we have passed. But today I am going to show you what DNC could not do or give us an answer. Hysteroscopy has taken us beyond that, and that is what is my idea in this today. Well, there are a lot of papers about uterine evacuation under vision. We all have done MTP. Today, of course, the incidence of surgical MTP has decreased. That's a really wonderful thing. But in some instances where this patient who has had a congenital uterine anomaly and recurrent pregnancy loss, to have, no, it's why, jump mara, 1 minute. Jump kyun mara? Udhar se slide kiya. Okay, sorry. He tried it. Anyway, so here, to do this DNC blindly would have been so difficult. We can take the help of sonography, but you can see the other horn is absolutely clean, and what we are having is just at one corner a missed abortion sac. So doing a DNC would have been definitely harmful for her. We are going to curate out more of the area which is not required, inducing more adhesions. I am sure here under vision, I am able to not only exactly localize where it is, so the safety aspect is tremendously improved, and at the same time, I am not an iatrogenist. I am trying to avoid damaging that part of the uterus which does not have anything. So the rest of the decidua will fall on its own. So not only am I doing safe, but at the same time, I am also not an iatrogenist. I have not done damage to a woman who has already had recurrent pregnancy loss. So that we get so many of these patients today, and we all land up doing DNC, and we can imagine how much damage we could have done. And here you can see the suction is beautiful under vision, the same suction blind which we used to do, and imagine that the uterus is empty, and we were all doing grating for the curettage. We are all waiting for the grating for the curettage to tell us that the uterus is empty. But here under vision, absolutely in just real time 2 minutes, the whole sac and the pregnancy tissue is completely out, and the rest of the other part of the cavity you can see is absolutely normal, and you don't have to touch that part of the endometrium. Well, today we all get recurrent pregnancy loss so much, and we all do karyotyping and So much advances has been made in the genetics today, WES and everything. But there are enough papers to tell us that there is fetal contamination in the curettage which we send. But if you do it this way, you can identify exactly what you want to take. So this was just a 6 weeks missed abortion. You can see even at that 6 weeks, you can identify every part of the fetus so beautifully. So sometime you may pick up certain abnormalities which were not seen on sonography. So that itself will tell you, yes, there was some abnormality in the fetus. So that is the advantage, and then you can pick it up, pluck it absolutely uncontaminated and send it for karyotyping or whole exome genome sequencing, and all. This is the beauty of doing it under vision. Well, this was something which I don't know who attended my live surgery from JK this Friday, last Friday for the IAG conference. You can see, I'm sure Bela Bhatt will identify and tell where is the heartbeat in this. You can see the heartbeat is much away from the fetal head. This was a 9 weeks pregnancy post IVF, and there my sonologist called me when I was sitting in the adjacent. He said, "Sir, zara dekho na, iska heart bahut niche hai, so something must be wrong." I said, "Yes, definitely take care and look more." And what we found was herniation at the umbilical area. So 9 weeks. So this was just last week, a week, 2 days before our annual conference where we were to relay. So what I thought of brilliantly doing it, why not put in an hysteroscopy and show to the audience? And when at the end of the day, maybe they even asked me, did you perforate the uterus, and maybe by technique miniaturize the fetal liver. So what you can see is something here amazing. So this was the same lady where there was just I showed you the sonography. So this was the gestational sac. We have entered without any dilatation, and there the sac, some part you can see vascular, so exactly selected the point where there is no vascularity, and we entered just out of interest how it looks like, and we were amazed by what vision we got. So definitely this adds to our value later on, that you can do something better and pick up very rare abnormalities. And here you can see the upper limbs, the fingers, and you will see very soon something you all must have never seen inside the uterus. And of course this is the nose and the 2 eyes, and then you can see the upper arm. Of course, my sonologist, my daughter-in-law also picked up that 1 foot could be seen, but the limb was not seen, but we were unable to trace it. We tried, but that is the umbilical cord. I wouldn't describe what is this. Even at 9 weeks, you can see that so clearly. But what you will see now is something terrific. See that. Liver, intestine, gallbladder is seen at 9 weeks. Can you imagine this? Gallbladder at 9 weeks, and that's the yolk sac there. And so all this under vision. So you can pick up a biopsy directly and take it. So this was the vision which we got, and it was something amazing for us. So this was live relay on last Friday from JK to Kolkata. So this is something which we all have to realize what we miss by doing that blind procedure inside the uterine cavity. So this was just out of interest we took. But so many other abnormalities which are not picked up at 9 weeks and 8 weeks could be seen under vision, because you have something more. You can see it under hysteroscopy, and believe me, you can see every part of the fetus or the embryo at 9 weeks, spine, limbs, everything can be seen. So this was the beautiful live relay we had. Of course, moving on to the postmenopausal. Women are living longer. You can see this particular lady was referred to me. She had come down from UK. Where is the os? It's in the posterior part of the vagina. A gynecologist previous day attempted, because she had postmenopausal bleeding, and UK she was going to get appointment after 3 months. And she tried, she said, okay, she'll come down. She was an embryologist herself, and she said, I couldn't see the vagina, cervix, nothing, maybe there are adhesions. I said, refer her, and next day she did come, and after 15 minutes when I came out, absolutely cool, the husband and the son, they said, are you joking? You finished in 15 minutes. That doctor couldn't see where was the cervix. But I said, nothing. That's what hysteroscopy is all about. He can exactly locate where the os is. The cervix may not be seen. The ear, this was the only patient where I've seen the cervix is almost in the posterior wall, the external os, and all you needed was the small graspers and scissors just to open up, dilate, and without a drop of blood, enter into the cervical canal, have a virgin view, and you can all under vision. Only you have to be a little more patient. You can imagine this cervix to be dilated. It would have been impossible to hold it. Forget about dilatation, and there you can see the canal. The mucosal folds are still maintained because you have not dilated. So avoid dilatation and under vision, enter exactly where you have to enter. And you can see that the 2 millimeter scissors does wonders for you, and you can see the polyp which is there inside, which would have been otherwise, means of course she could have been directly taken for hysterectomy and done a frozen section, and all those things can be argued, but that is not the answer. We have to find out what we are dealing with. There are women who come at 70 and 80 and tell that you first diagnose what I have before you are telling me for a major surgery. And here you can see the polyp with abnormal vessels, and of course you don't have to again curate it out. You can take a biopsy and come out, but if with the presence of STRS we could just remove everything, and she had additional polyp which is close to the first polyp, and we sent both separately. This came as malignant, that didn't come as malignancy. So this is the beauty of hysteroscopy. So under hysteroscopic vision only we can diagnose that there is high chances of malignancy in this patient. This was the other polyp. I'll move on to the next. So, of course, you can collect every bit of it with the filter where it is collected and send for histopathology, everything. But this was another lady who had come with recurrent chronic discharge, DNC done multiple times attempted. They could not get a relief, and then once we put in a hysteroscope, we thought we are in a unicornuate uterus where you can see the other part of the external os on the other side. So this was a bicornuate uterus where this MRI just represented it as a 4.5 centimeter lesion in the upper part of the cervix or vagina. So that cervix or that uterus had the pyometra. So under vision, once you enter, you definitely of course have a whole visualization of the cavity. You can take biopsy, definitely you have to take. And more important is the patient is totally relieved. After multiple attempts at DNC, now she is so happy because that disturbs. Women believe that after 50 or once the menopause starts, that all gynecological problems stops. But today, women are living up to 80, 85, 90, and their gynecological problem continue to haunt them in the form of postmenopausal bleeding, all this discharge, thickened endometrium, adenocarcinoma, and you need to really find answers for that. And that is where they are going to approach to us as gynecologists, and we have to answer them. This was a 72-year-old lady who came down from South Bombay to Dombivli telling that there was a sonography done for something, had such a big mass. You can see the mass there in the sonography. Her cervix was definitely fibrotic, and the same technique we did use it to open up that particular external os with the scissors and this. Once we entered the canal, there was more fibrosis. So some of them, definitely fibrosis changes does occur in postmenopausal, especially after 20 years of menopause. You can see that the cervix could not be as easily cut with the same scissors, and we needed something else. Again, dilatation was not the answer for me blindly, and we were wanting to do dilatation under vision. And so we had to use something which is available today and help us exactly dilate under vision, exactly enter into the cavity, all under vision. That's where we started using the STRS. You will soon see that how it scrapes the wall around it and helps you to, welcome Mr. Annadurai, the moon man of India. So here you can see that under vision you are trying to scrape off those fibrotic areas of lower half of the canal or the upper half of the canal, the lower half of the internal os. We couldn't enter even with that 5 millimeter sheath without dilating it further, and that's how under vision you are seeing that small scrapings are being done by this HTRS, and giving us the way to enter into the cavity more smoothly. Again, not drop of blood, not a drop of blood. So the vision is always beautiful. Hysteroscopy, you will always find that once you have blood inside, your vision becomes so difficult, you just can't appreciate the real virgin view. So unless you have these technologies which are available, and you can see the exact view what is required. And this lady luckily didn't have malignancy. So she would have otherwise landed up with hysterectomy. So she was more than over the moon. You can see there still little bit of fibrosis there, and we are entering into the main part of the cavity, all absolutely under vision. You can see that large 3.5 centimeter polyp, and this definitely even the hysteroscopic view, though there was a little abnormal vessel, but rest of the polyp was absolutely avascular, and it came at non-malignant, and that's where the surgery was, major surgery was avoided. So the same STRS why we could use to remove the whole polyp and collect it and send it for histopathology. You can see more part of the internal os being scraped by this HTRS there before we enter into the main uterine cavity to identify the polyp and remove the same polyp. It was not even letting us, this is a 5 millimeter HTRS, it was not going even without those minor scraping which had to be done in the upper border, and finally we could enter and prove that it is not malignant, and she was completely relieved of her pathology without any major surgery. So this again STRS will do the wonder. I wouldn't continue showing this. Well, this was a very interesting lady. The lady was about 140 kilos. She had undergone a bariatric surgery in 2013. Continued, she had, you can see a medical history, lung fibrosis, bronchiectasis, she had a history of pulmonary embolism, she was on oral anticoagulants, apart from being hypertensive, ischemic heart disease, hypothyroid, everything possible, and a benign polyps and bleeding continued to haunt her. She was taken for, twice DNC was done, again the bleeding persisted, so in Pune hospital she was subjected for TLH, but she had unfortunately cardiac arrest on table. So they revived her and then put in a Mirena and sent her back, because that was the best thing they thought we can do, but her bleeding never stopped. And this was again when she came to us, what we thought was at least do a TCRE. Why her polyps were being produced? Because of the obesity, estrogen was being produced in her fat, and that was causing benign polyps. So she had, you can see the Mirena inside, and under spinal we didn't want to give a GA, definitely that was the advantage that you can do it under local anesthesia, and spinal is the best. So for those, she was absolutely safe, and granddaughter was a medical student in one of the Pune college, where she must have seen me in one of the conferences. She said, let us go and to Dombivli and find out what we can do. You can see the small micro polyps. So this was the mini resectoscope, which since we had again no dilatation, under vision, the whole of the endometrium, you can just scrape it out, and again of course this came as benign only, and now she's comfortable. We did put her on a very short course of letrozole therapy to prevent that estrogen being produced by the fatty tissue, so that we know that the effect of our TCRE has come full. So we didn't want endometrium to grow, so I gave her a short course of 3 months letrozole therapy, 5 milligram per day, continuously for 3 months, and absolutely now after 2 years, she is absolutely fine, and she still remembers to send me Christmas cake every time, last 2 years. So this is the beauty of our advancement which we have, and why should not we use all these things for the benefit of patients. Ultimately, we are gynecologists, and everybody is going to come to a gynecologist for this problem, and you can't say, I don't have an answer for this. So this is, you can see completely how we are doing the resection of the endometrium with that small mini resectoscope, which is 5.5 millimeter. Again, something more interesting, the youngest I've taken the help of hysteroscopy is what you're going to see next. This was a 10-year-old girl who had come with pain in abdomen, and she had an hematocolpus. You can see the uterus and you can see the hematocolpus, and she had a unicornate uterus, which was almost, she was just 10 years and few months. And MRI did tell us that the distance from the perineum to the obstructed area was just 2.65 centimeter, and that's why when I thought that under ultrasonography control, we will try and see whether we can open up that septum and relieve her. And this is what you're going to see. This was the abnormal looking anus which was being pulled by the fibrotic layer here. You can see that is the urethra, and there was no entry. And we did a cystoscopy first to see the exact location of the bulge, and definitely cystoscopy was smooth. You can see the urethral opening, the right and the left. So there the bulge in the posterior part of the lower part you can see this, because then we did a per rectal examination and then locally injected at the perineum saline adrenaline, and then did a sharp dissection for about a centimeter, and then took the help of Veress needle to perforate that particular, you can see Veress needle, so that I'm very exactly where it is. Then I thought of a brilliant idea of pushing the pterimo guide wire through the Veress needle, and then so that the location of the perforation I can maintain, and then use the sheath, push the retrograde pterimo guide wire into the hysteroscopic sheath, and under vision you know where the pterimo guide wire is, and we entered, or we opened up the membrane which was there, and there you can see the cervix which is studded with all the blood products, and you can very soon see the unicornate uterus with the ostia directly pointing to you. And we opened up with the 2 millimeter graspers, further cut it more with the scissors, the transverse vaginal septum which was there at that particular point, and put in a drain. And around the drain we opened it up further so that the mucosal fold could be pulled out. We got extra tissue of the mucosal fold, and the anterior and posterior mucosal fold were pulled out and sutured onto the perineum with non-absorbable sutures. You can see the placement of the sutures. And once this was done, definitely it had to be kept patent. So we created a mold with a finger glove, and kept it for 8 days. This was the vaginal mold made of the gloves, and then the interseed was just kept around it to prevent some adhesions, if at all. And after 8 days, when we went back, we could see the opening still maintained, and again we put in the hysteroscope to see the whole vaginal opening, the vagina, and now you can see the clear cervical mucosal fold where there is no blood, and here you can even see the unicornate uterus. And of course then the girl had to continue dilatation, because since it was just a distance of about 2.5 centimeter. Just last slide, last video. So this is the whole mucosal fold you can see in a 10-year-old girl. This is the hysteroscopic view of the distal vagina. So to achieve gold standard, we have to adapt to the innovations which is definitely safer, more efficient, not only less painful, and you are going to give the highest quality of therapeutic care to your patients. Remember, this is not a sprint. This is a marathon. We all have to take step by step, improve upon, learn these things, adapt to all these innovations, because at any stage of the life you will get women to us as a gynecologist, and we have to do them the right thing, and we need to do it for them. Thank you.
Ladies and gentlemen, you'll agree that this qualifies for 3 M's: monumental, mesmerizing, and marvelous.
Thank you, thank you.
Beautiful presentation of your art, skillful art, and extremely good videos. I think you're doing an amazing job, Krishna Kumar.
Thank you, thank you. That's why I want every gynecologist to start doing, learning, mastering hysteroscopy.
True. the embryoscopy was extremely good.
Yeah,
This
that's
is really satisfying, and it has reached really good standards. Abroad, they have classifications of embryos.
Yes, sir, there are
as
lot
per
of
the
papers on
Carnegie
embryoscopy
classification.
now.
Yeah, and this is rewarding basically because when you're investigating for recurrent abortions, this is something which can be done easily. So thank you.
Thank you so much.
Thank you to our respected speaker and chairpersons. I request our chairpersons to please felicitate our speaker, Krishna Kumar sir. I request Dr. Rakesh Pandya sir, our past president AFG, to felicitate our chairpersons. Dr. Mukesh Gupta sir. Dr. Seema Gadiwan madam. Dr. Rajkumar Shah sir. Can we have a round of applause for them, please? We'll now continue with our scientific session for the morning. I request our chairpersons for the next session to please join us on stage. Dr. Rajendra Nagarkatti sir. Sir has been past president of AFG. Welcome, sir. Dr. Navneet Desai, madam. Madam is currently joint treasurer of AFG. Dr. Karthik Bhagat, sir. Sir has been past president of AFG. Welcome, sir.
This session is sponsored by Koei Pharma.
So, our speaker today is Dr. Atul Ganatra, sir. He is past President AGE, past VP of FOXY, President-elect IMA Mulund, and Joint Clinical Secretary of MOGS.
Atul is not an individual. Atul is an institute. And I don't know whether he sleeps.
Thank you very much, Nitin, for inviting me here. I'm going to only start this talk. Nitin, this is for you. I'm going to start this talk only if you promise me you will become IIG president one day. But there are so many presidents here. We have the AMC president, we have the... I'll do it, मैं करूँगा. We have many IIG past presidents, we have many AFG presidents.
Right here, right now.
I know. So, thank you very much for inviting me. It's always a pleasure to come here and speak, and with this caliber of chairpersons and the man of Chandrayaan, I'm going to get a little glitters. We don't grow when things are easy. We grow when we face challenges. And I think this is one thing that I have learned over the last couple of years working at my hospital in Fortis. So my talk today is, are we prepared? We should be. And my talk is going to be in 3 parts. One is medical preparation. Second is a non-medical preparation when you have a problem either in your family or yourself. And a third is going to be some discussion about the medical management of endometriosis. So I hope I don't overshoot too much of my time. This says 18 minutes, Nitin. I will need a little more time. The most important thing that we need to remember, premium no share. This is something that Noza taught me. Please do not do any harm to our patients. Just because I can do surgeries, just because I can do resections, it doesn't mean I will do it. We will do it only if the patient needs it. Vivek is here, one of the finest surgeons in endoscopy. We have to have a checklist before we start surgery, because we deal with, in endoscopy, we deal with electric equipment, electronic equipment, which can fail sometimes. And we have to practice evidence-based medicine. So this is something, Karthik, you must see this. A patient who was referred to us who had crashed in another colleague's OT while a hysteroscopy DNC was being done. The minute we saw the patient, you can see there was air in the heart, there was air in the iliac vessels, the inferior vena cava, and there was air in the hepatic vessels. This patient had had an air embolism because the fluid was over, pressure was being given, and patient had about 20 to 100 ml of air injected. And thanks to the cardiac team at Fortis Hospital, in the ER, they put in a central line and they aspirated blood, and through blood they could see heart coming. They could get blood and air coming out, and they were giving the blood back through the IV line. We did a transesophageal echo, and by God's grace, the patient went home. This patient would not have gone home if not for the kind of backup that we have at Fortis Hospital. So request, please use an endomat when you are doing surgery. It's okay not to buy an iPhone 15 to an iPhone 17. An endomat doesn't cost more than ₹1 lakh. You can see this video again and again, and I get tremors when I see this video. I was there at that time when the patients came and the ER team did the preliminary echo. A second patient, a colleague calls me up and says, "मैं cesarean कर रहा हूँ, मैंने hysterectomy कर दिया है, but the bleeding is not stopping. What do I do?" I said, "Don't do anything. Put mops or green towels inside, as many as you can to create a tamponade. Put in a drain and send the patient." We just managed her coagulation profile, and you can see that I removed 12 mops 2 days later. I did nothing else, no magic, just manage her coag profile. And you can actually hear my voice counting the mops, because I had to do that because the mop count had to be correct, because I told that friend, colleague of mine, Baba, please count your mops. So I won't go into the details, but we removed 11 mops. This is something that all of us practicing at nursing homes should do. a simple small mop will not do. You have to either put a proper full green towel or put 10 to 12, 10 by 12 mops. No Gemji pads. Your blue liners of these mops have to be kind of counted or, kind of tied together so that we can remove all of them. This is the third patient who came to us just in 25. These are all 2025 cases. Patient collapsed in the bathroom 10 days after a TLH. Very, very good endoscopic surgeon had done the surgery. The patient was sent home saying that there were a lot of dissections, so we are keeping the catheter in place. And the patient had passed a big clot. So the ER room, just across the ER room, we have the CT scan room, and we did a CT scan. We could see a large blood clot in the bladder, and she had hematuria as well. So we had to putting in a cystoscope. The urologist using the same hysteroscopic morcellator, they have their own morcellator. You can see that big blood clot sitting there. She had collapsed 2 times, twice at home, once she had gone to the hospital, but this time we just aspirated the blood clot and we removed the blood clot. We could see the sutures that there was a bladder which had been opened up, and then all those details were not mentioned in the discharge card. And you can see some sutures there if you watch carefully. The next step we did is did a laparotomy, and you can see that there was blood. We are trying to put some water saline through the Foley's, and the Foley's was continuously draining. So again, we did a bladder repair, but the bladder was so friable that she did develop a fistula, which eventually healed. It's not that only endoscopic surgery causes complications. This is a patient who was referred to us from Raigad 24 hours after OH, after a hysterectomy. There was no urine. And you can see here that both the ureters were ligated. You can see the sutures through it. We had to do a PCNL. We had to do a PCNL on this patient. A resident doctor putting in a drain, went through the bowel, TOT done, the mesh was in the urethra. Patient complaining of pain. And I can go on, but I don't think I should go into the details of this. Again, another post-TLH complication. Second time patient was opened up. One of the iliacs was ligated. She still had bleeding. You can see here that large hematoma in the abdomen. We went in, we removed the hematoma. The ureter was almost blue in color, as if the vascularity had been compromised. We covered it with an omental flap, and we came out. I had done a hysterectomy on a patient I had delivered just post-COVID. She had COVID 3 months ago. Everything went well. Unfortunately, on the day I was supposed to do her surgery, my brother died. So I said, I don't want to do the surgery. Should I ask somebody else? She said, no, sir. I will wait whenever you are comfortable. So we finished all the formalities and we went ahead and did the surgery. Surgery went well, and this is the message I received from the husband. Thank you so much for finding time to complete Poonam's surgery. Thank you from the bottom of my heart. May God allow your brother's soul to rest in peace. She was doing very well. I saw her in the evening. She was having coffee. Some injection was given to her. One injection, MSET pan was being given to her. She had a severe headache. She had she arrested. A code blue was diagnosed. She developed cerebral hypoxia. 3 minutes time is our code blue time. Another patient, we had done a TLH during COVID times, had massive mesenteric vein thrombosis. 21 days later, she comes with an acute abdomen. So this is something that I thought that we had done something wrong, but this was just thrombosis because of COVID. And I can just go on, but I'll stop here. I'll go on to the next topic because I think time is running out. Day 3 post-op after a DIE surgery. Again, there is a sigmoid perforation. Day 5 after endoscopic surgery for DIE, perforation, colostomy done, colostomy failed, patient developed fecal peritonitis and ARDS. Then she went home. Another colleague operating nearby to Fortis Hospital put in a trocar which went into the aorta. You can see that rent in the aorta. When she came to us, there was no pulse BP. The ABG was 2 grams. But when I was starting a cesarean section at my hospital in my same clothes, I came down. I called Anvay Mule, my cardiac surgeon. I called the cardiac anesthetist. I called the ER head. Within 20 minutes, we were in the abdomen. No money, no blood, no nothing. MBT protocol launched, massive blood transfusion protocol. This patient went home as well. So, I mean, it's not any magic, it's just the kind of backup we have. Another patient here, myomectomy done a year ago, came to us with pain abdomen. You can see that large collection. The minute we made an incision, there was pus coming out from there. I'm sorry, Mr. Annadurai, I'm making you see all this, but parasitic fibroids, we've seen many. Please do in-back morcellation or open morcellation. This is a patient, an air hostess who had come to us with melena. She had undergone 2 open myomectomies, 2 embolizations. She came to us with melena, upper GI, lower GI, normal, colonoscopy. So we went to the radiologist and we said, "Kya ho raha hai? Why is she bleeding?" So she said, "Sir, I can see a big mass. And there is a vessel there which is draining into the mass." We went ahead, opened the abdomen. The parasitic fibroid had perforated the bowel. And she was bleeding from there. You can see that hole in the ileum. We actually had to do a resection and anastomosis. So, friends, that's about medical preparation. Another patient with a leak after a ureteric injury, and you can see a bladder opening up, and you can see this Lay's effect in the bladder, in the urine bag. So these are some situations that we deal with. Again, in a post-pickup patient, dermoid cystectomy was being done. Patient had pus managed. Laparoscopic hysterectomy being done on a patient whose ultrasound was done 4 months back. She went to her village and she came back. The gynecologist calls me and said, "So kuch acha nahi lag raha hai." I said, "Send me a picture." I was in the OT as well. She sent me this picture. I said, "This looks like an ovarian malignancy. Just take a biopsy and send it to me. I'll do a frozen section." This was CA ovary. I said, "Please don't do anything. Leave her alone, close, and we'll come back." So this is so much about the medical part of it. Now we come to the other aspect. Are we prepared for a medical emergency in the family? Most people know I had a medical emergency or a medical problem. And you need to have a backup plan. Anything can happen to anyone. I mean, just 2 days ago, one of our surgical residents on a scooty was crossing the road and she was hit. And today she's lying unconscious with a concussion in the brain. She's our DNB student. She was just going home after a night duty. So accidents can happen. Medical emergencies can happen. Just let's listen to this.
अच्छा मेरे को एक बात बता. What is money? Money? Money.
That's a confusing question. Paper. Money to me is basically having the freedom. Money is my life. Money is.
Can you hear it? 1 minute.
Everything begins with money and ends with money.
Something that you need for basic survival.
The more you think about.
Is the audio on?
अच्छा मेरे को एक बात बता. What is money?
No, it's not heard.
Money.
Money.
अच्छा मेरे को एक बात बता. What is money?
Money.
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 That's a confusing question. Paper. Money to me is basically having the freedom. Money is my life. Money is necessary.
You get a lot of girls, guys, even
Everything begins with money and ends with money.
something that you need for basic survival.
The more you think about money, the more you'll end up thinking about the lack of it, and that thought is just depressing. Your life, almost. Unless you want to become a hippie and sit on a mountain. Don't do that.
You don't need money to be happy. You need something
I don't need love to be happy.
Okay.
So money. I think there's a lot of discussion. I'm sure Nitin, the financial whiz on this side, has said. So when there is a medical emergency in the family, you need a backup plan, because most of us what is a one-man show. I stop working in the hospital doesn't function. I mean, if it's a corporate hospital, it's different, but you stop working in a corporate hospital, the corporate hospital stops paying you, unless you're a full-timer. Even a full-timer will not get paid. So there are a couple of things that you need to look at. Family, staff well-being and pay. When I was ill and I couldn't work for a year, I didn't know if I would be able to pay my staff. Because an X amount is definitely necessary every month to pay your electricity bills, staff payment, which would go into 10, 15, 20 lakhs depending upon the size of the hospital. Unpredictable future. You are the mobilizer, like he is the influencer. Consistent resources for the family, uncertain prognosis, because you don't know at the end of it, are you going to make it, are you not going to make it? Because you are the only working member of the family. Of course, my wife does work. So, basically, what is the best investment? Is there a best investment? I don't think there is any single best investment. There is nothing like a best investment. It is in a mix. There is no standard mix. Regularity is the key to wealth. There are 4 governing principles. If a person adopts the formula income minus expenses is equal to saying, he can never become wealthy if you want to become wealthy. The correct formula is income minus savings is equal to expenses. So you need to save. This is for youngsters here, not for, people who are on the verge of retiring. I turn 60 in a month. 30% must go for your luxury. Everybody wants to enjoy. How should you spend your money? When you are in the 20s and the 30s, 50, 30, 20 rule. 50% must go for your basic needs. 20% must go in savings, 30% in luxury. And you need to start young. You need to start young, and I'll tell you a couple of things that we did which probably helped us. Start early and reach safely. Gold and greed can never stay together. It's all right to have an iPhone 15. Just because 17 and 18 comes doesn't matter that. I mean, it doesn't mean you need to go into these. You can have if you have the surplus. Purpose must decide the choice. You have to have a financial pyramid. Draw the map before you start the journey. Professional support helps. I was lucky I had friends. Start early, save more even if you invest less every month. If you invest 1 lakh rupees annually for a period from age 31 to 60, 1 lakh rupees a year from 31 to 60, the compounding interest lets your money grow for a longer period of time, and your return of investment will be around 18%. So, if you invested 30 lakhs from 31 to 60, you get returns of about 1 crore and 13 lakhs. But if you start between 45 and 60, that's when a lot of people start. You make 15 lakhs and your end returns around 30 lakhs. So the moral of the story is you need to start early. So the financial pyramid, I think this is something the youngsters have to look at. Protection. The first thing that you need to do is protection. Protection is protecting the flow of income. Term policy, health insurance, critical illness cover extremely important. Non-negotiable duty. There is no question that you must do this even when you start practice. Your numbers could be small, the amount could be small, but you have to start here. Risk-free growth is the second aspect that you need to jump into when you have money after you finish this. Protecting the capital, PPF, bank FDs, life insurance, secure bond. It could be a gold bond for 5 or 7 years. Even if they give you a 2.5 interest, it's all right. But it's a risk-free growth. Non-negotiable, no risk, responsibility, and self-reliance. This is what will work. God forbid you are unwell. Now comes growth with some risk, is what F&O, what Nitin talks about. Beating inflation, mutual funds, equity, and ULIP. ULIP is as we call it. Nice to have moderate and aggressive risk. Now, what is ULIP? United Linked Insurance Plans. Remember, this also helps you. What does it mean? It gives you a premium that is bifurcated into two parts. Money invested in equity, debt and others. Units are allocated upon the ULIP investment. Value of units as NAV. NAV means net asset value. Policy maturity, full fund value is paid up, and also it gives you insurance. I think this is extremely important. This is the next pyramid that you need to climb. And the last one will be high growth. Multiplication of wealth, real estate, venture capitalists, diamonds for your wife and your family, or gold, which they will always want. Nice to have legacy. And the final thing, friend, is speculations. And then you go on to speculations if you have money to spare, because with the current war, you know what is the status of the market. Shares fall. Of course, they fall on paper. And for extra money, future options, derivatives, you can do whatever you want. So I think these are some things. Risk-free growth, first is protection. And this is the pillar and the foundation where your family will sustain in your absence, when you don't work. Then you come to growth with risk and high growth, and then touch the ceiling. This is important. So this is the pillar between this. Unless you bypass this, I don't think you need to jump here. Risk-free growth is the pillar for all turbulence that you may have in your life. Remember, I did not work for about 10 months. I was sitting at home. Classification of income: active, semi-active, passive but not guaranteed, passive and guaranteed. And listen to this.
Gen Z, those born between the late 1990s and the early 2010s. The oldest among them have just entered their late 20s, and they're already anxious about their retirement. In fact, Gen Z have a term for such worry. It's called retirement anxiety. No surprises here. This is the same cohort that came up with menu anxiety for when people are confused about their order at a restaurant. Linguistics may be an extreme sport for the young. But that aside, they aren't alone in their worry. Even millennials have retirement anxiety.
So, standard dialogue, 40 तक कमाऊंगा फिर रिटायर हो जाऊंगा, but 40 तक जिंदा रहोगे क्या? That is more important. So you need to plan young, because anything can happen anywhere. Basic insurance schemes that you should buy. This is my advice to everybody. Mediclaim, adequate Mediclaim for the individual and the family, with a floater covering. Professional indemnity with the kind of work that we are doing. Term insurance. So I've got a term plan since I was 30, which will give me about 3 lakh rupees every month from the time I'm 60, which is about 2 months from now. So 18 lakhs a year, and even if I don't work, I think that should hopefully be enough for me and my family to survive for the month. Pension plan, this is what I was talking about. And these 2 additional policies that did very, very well with me. One is an extra policy called the heart and cancer policy, and a top-up cover. The heart and cancer policy, the minute you give them a diagnosis of a cardiac or a heart problem, no questions asked, they give you that lump sum. If you put in 20 lakhs, they give you 20 lakhs, 50 lakhs, they give you 50 lakhs. And a top-up cover means, say if your regular cover is 10 or 15 lakhs, then you buy a top-up cover of about 50 lakhs. It costs you around 10,000 or 20,000 depending upon your age. So if your expense is more than 10 lakhs, which is your primary cover, then you can use that rest policy. I think these are some simple tips that I would want to give. During my illness, I think these were my pillars of strength. People who really helped me. 2 basic pillars. KK looked after my hospital with all endoscopy and hysteroscopy surgeries, and all these people who helped us during our bad times. So thank you very much. I think this is what I wanted to say, and this is the final thing. Time doesn't heal all wounds. What you do with your time does. Just keep waking up every day and take 1 step forward. And one of these days you will wake up and realize that you're not only feeling a little better, you are better. And friends, thank you, I'm better. I'll now go on to the last part. Sorry, I'm boring you all with all these things, but I'll now go on to the last part of my talk. I think an extremely important subject that we need to discuss, endometriosis. I think all of us are seeing so much endometriosis every day. My youngest patient of endometriosis is 16 years. Her only complaint is dysmenorrhea. What are you going to do? I'm going to operate this patient. I did a CA-125 on her because the mother had to be convinced that at 16 she needs to take some medication. So patient-centered approach is very, very important. You need clinical expertise, best evidence, and patient values. So medical management of endometriosis is what? Gold standard is laparoscopy now, but new advances, transvaginal ultrasound, MRI, and your clinical judgment is going to tell you whether this patient needs surgery or she can be managed medically. The goals of treatment: pain control, disease suppression, recurrent prevention, quality of life, fertility preservation. Now this is a 20-year-old girl who came to us with severe adenomyosis. You can see that. Multiple fibroids and adenomyomas. We removed 10 fibroids. She had a large endometriotic cyst. In this girl, I'm going to operate? Yes, I did operate. But what am I going to tell her? Surgery khatam, all well, no problem. It doesn't work there. This patient has to be on oral medication till she gets married or till she is ready to have children. Because one thing is sure about endometriosis, it will come back. That's what I tell my patients. 100% एक बात बता सकता हूँ, वो वापस आएगा no matter how good the surgery is. So she has to be on medication, whether she's 16, 20, 30, 35, till she's ready to bear a child. So I told them, we need amenorrhea. Amenorrhea how? Amenorrhea of injections, amenorrhea of tablets, amenorrhea with pregnancy, amenorrhea of breastfeeding. When I said this to one of my patients who's 28 years old, she came to me 4 months later with a pregnancy. So I told her, when did you get married? Doctor, you never asked me to get married. You just asked me to get pregnant. So I'm pregnant. So communication skills, I think we need to have that. And this is a true story. She got married in the 7th month of pregnancy. Another patient here, you can see, unmarried patient, going to get married in a year's time, diagnosed with endometriosis. We did the surgery. We use a lot of ICG for ureteric protection, because otherwise we will have to dissect the ureter like this. But because of the ICG that we use, we can see the ureter, we don't have to do a lot of dissection. So first line therapy, OC pills, because they suppress FSH and LH, best cyclical dysmenorrhea. At least a 3 months continuous cycle is very, very important. But I have a problem here, that my 16-year-old girl's mother has a problem. The patient may not have a problem. Because you say, छोटे बच्चे को hormones खिलाएंगे, 21-day pills, ये तो बच्चा नहीं होने की दवाई है. So agreed. So then we go to the next option, Dynogest. I think this is something wonderful. I've given it to more than 150 patients of mine now who are on Dynogest, and one of my patients has been on Dynogest for the last 8 years. There are German studies now who say that it can be very, very easily given up to 10 years. Another patient of mine who took it for 8 years and stopped it, she's in Canada working for an IT firm. She's an engineer by profession after we have operated. She stopped Dynogest at the end of 8 years. Because ChatGPT and AI said 8 years. 3 months later, she messages me and says by email, I'm having the same dysmenorrhea. I don't like this dysmenorrhea. I haven't had dysmenorrhea for 8 years. She started Dynogest again. If there is adenomyosis, I think LNGI-US works very, very well. So the second line therapy. My problem with Dynogest is if the patient doesn't take it for a day or two, a 16-year-old girl may forget and she starts bleeding, then the bleeding doesn't stop. So if that happens, I'm going to switch around to the next drug. Obviously, it is going to be surgery. If there is a large cyst or DIE, then I would give her Leuprolide for a month or two. Then I would put her on Dynogest. 9 on 10 times the Dynogest works very well. 2 milligrams per day. Sometimes they do get pimples, which another patient of mine had got. She had urethral endometriosis. And then I put her on to Illegolix, and now she's very happy. But you need to give add-back therapy. Because with a smaller dose of Illegolix, 200 milligrams once a day or 150 milligrams once a day, nothing happens. But if you have to give a stronger dose, you need to give an add-back therapy. Others, you could give an NSAIDs, you will have to give neuromodulators, pelvic floor exercises, intervention, breakthrough. There are new breakthrough treatments which are just coming up. It could be Endo 205, this is LNG. I mean, this is, I'm going to come and talk to you about it. There is HMI 115, and there is, of course, the thymosin alpha. So this study, literature search that we did, the first one, Endo 205, is nothing but DMPA 205 milligrams to be given once in 12 weeks. We could give it earlier or later. And it's not coming, its FDA approval has just been sought. Stage 3 trials are going on. Hopefully it will come into our country and we'll be able to give it to them for once in 3 months dosage. Now this is something which is happy. I'm used to using DMPA for contraception. We just need a slightly higher dose because there is 150 there. We may have to give a slightly higher dose. The second drug is the subcutaneous injection of HMI 115. But they don't have the exact dosage, just phase 1 trials are going on. And the third one is the thymosin alpha, which a lot of companies are talking about. We used it during COVID times for patients of endometriosis. They do get pain relief. But how long can you go on? The drug is expensive. So management for patients with infertility. If they have an endometriotic cyst, surgery followed by COHS and IUI or IVF. Recommended medical therapy, if you go on to any hormones, they will not get pregnant. So the pathway is surgical excision of endometrioma. ART, IUI or IVF is preferred. Primary surgery should be the best surgery and should be delayed till the patient is ready for surgery, or she will have to go on to hormonal medication.
Atul?
If you operate and don't give hormonal medication, she's going to come back. So in conclusion, medical therapy is now the primary goal. Progestogens, Dynogest probably works best 9 on 10 times. GnRH antagonist, that is oral elagolix, is wonderful. I even use it for OHSS when patients are referred to us with effusion and ascites. And we are entering an era of non-hormonal drugs like HMI 115 and Endo 205. Thank you very much for a patient hearing.
Thank you, Atul. I don't know how this man survives because the kind of work that he does, if I were to take the kind of work he does and take tension, I would have died years ago. The second part of the lecture he spoke about, where he speaks about managing himself and the family. The same principles apply to the first part. So if you are not good, if you are not ready to learn, and if you don't have your backups, you will not do the kind of work that he does. So if he's done this kind of work, it is just not himself, but the kind of people that he's gathered around him and the kind of backup that he's created. So when you as a doctor operate, your identity is as a doctor. If the scientists were to look at money, then they wouldn't reach the moon. So as a doctor, your identity is to stick to your subject, improve yourself, improve the people you have around you, and improve the infrastructure. The rest should be left to experts. We are learning about wealth, which is good, but we are primarily doctors and we are not wealth creators. So let that distinction remain. You do what you are supposed to, you do it well, and probably you'll reach where he has reached. Thank you, Atul.
And the bottom line is be prepared always. So this question was, are we prepared? So we have to accept it and be prepared, whether it's a small surgery, whether it's a big surgery, a major surgery. We have always to be prepared. One of the things that I would like to suggest is, even for a simple cesarean, always have a blood, a cross-matched blood ready. That is the dictum today, and the rest of it he's already said. So thank you very much.
Thank you. The backup plan is for you and your family and your staff.
Thank you, sir. Dr. Ganatra, please stay back on stage. I request our chairpersons to felicitate our speaker. I request Dr. Raju Tayate, sir, to felicitate our chairpersons. Dr. Karthik Bhagat, sir. Dr. Nagarkatti, sir. Desai.
And another thing is have your backup man ready always. So you may not have an Atul Ganatra near about you, but you can have a Dr. Sarogi or an Dr. Agarwal near you. So keep them always in your contact.
Dignitaries for the lighting the lamp.